Good morning, everyone, and welcome to the UC Systemwide Anchor Institution Mission Summit. It is our inaugural summit. We're really excited, and so we're going to give everyone just a few minutes here to join us, and then we'll begin. Right. So, for those just joining us, I want to say again, welcome to the UC System-wide Anchor Institution Mission Summit. It is our inaugural summit, and so we're really excited to share a lot of information around the Anchor mission with you all. But before we do that, I just want to say welcome to all 10 of our UC campuses, our University of California Office of President leadership that is also in attendance. We are really excited to share the strategies, initiatives that we have been working through across the various campuses as it relates to our anchor mission. And we are just really excited with the amount of attendees that are here as well. And so we want to tell you welcome and that you please hang in there. If you have any questions, we have the chat function, the Q&A there where you can ask the panelists questions in real time. And we will be sure to answer those questions as they come up. But before we jump into the agenda, I do want to just give an overview of what you all can expect today. And so we have a welcome and opening remarks, and then we'll jump into our keynote for this morning. We'll give you a bit of an overview of our Anchor Institution mission journey from our various UC leadership. We'll also jump into a community investment panel where we'll talk about what does impact investing look like. And then we'll have a break, and following the break, we'll jump into our impact procurement, our workforce development panel, and then we'll have closing remarks. And so it's going to be a jam-packed morning, but full of information that everyone is so excited to share and so much wisdom across all of our panelists and our speakers today. And so without further ado, I would like to welcome our keynote speaker for the morning and opening remarks. And so we have Rachael Nava, who is the University of California's Executive President and Chief Operating Officer. In this capacity, she serves as a strategic and operational partner to the UC campuses, 6 health centers, and 3 national labs. UC, as we are aware, is a $43.9 billion enterprise that serves more than 294,000 students and employs over 230,000 faculty and staff. Ms. Nava oversees the UC Operations Division at the Office of President, which is comprised of over 1,000 staff with responsibilities for system-wide human resources, information technology services, operations services, strategy and program management, community safety, workplace belonging and inclusion, and all the business services within the Office of the President. And so, as you can imagine, Rachael Nava is extremely busy, but also extremely important, and we are so glad to have you here this morning.
Thank you so much, Michael. I'm sorry you had to read all those departments and divisions. Good morning, everybody. I'm really thrilled to be here. I should just say up front, I'm recovering from a head cold, so I'm a little congested and I might cough along the way, but luckily we're on Zoom, and so I'm not passing any germs to anybody. I'm really thrilled to have the opportunity to just welcome you all to the inaugural summit this morning. I'm really honored that I was invited to attend this event. I'm very excited about the work of the Anchor Institution mission. I've been at UC for almost 9 years, and the work that we do at this institution continues to engage me both mentally and challenge me as well politically. But I will tell you that what we do is core and well aligned to the Anchor Institution concept. So for those of you that are not entrenched in the work of the Anchor Institution, these are place-based, mission-driven entities, such as universities like ours, hospitals like ours, and government agencies, of which we are, that leverage their economic power alongside their human and intellectual resources to improve the long-term health and social welfare of their communities. So when I look back at my own career and the work that I've done, pretty much everything I've done is kind of wholly aligned to that Anchor Institution concept. So before I joined the university, I spent the majority of my career working in healthcare institutions that serve low-income, indigent, and unhoused populations. And I really did this work because I believe strongly that everyone deserves access to high-quality healthcare. And I've seen up close the difference that it can make in an individual's life when they have access. You know, if you're a Medi-Cal recipient and you have access to the same quality healthcare as a commercial patient. And so I did that work for a long time because it spoke to my heart and my values. And then I was motivated to join the university really for the same reason, because access to higher education, just like access to high quality healthcare, is lifting families out of poverty. It's providing social and economic mobility for families and communities. And in my opinion, UC does this better than anyone. So while California's economy outperforms the nation, I think it's also important to note that the level of income inequality exceeds all but 5 states. Community health needs assessments that were conducted by our 6 academic health centers show that significant disparities and inequalities in health outcomes exist for the state's most under-resourced communities along race and geographic lines, which is placing our residents, families, and children at risk. So improving health outcomes requires us to focus our attention on removing obstacles to good health, including the impediments of poverty and discrimination, which is associated with reduced access to jobs with fair pay, education, housing, safe environments, and healthcare. So the University of California is an essential economic engine for the state. We all know that. We're contributing roughly $82 billion annually to California's economic output. I mean, let that sink in, 82 billion, that's a really impressive number. Over 500,000 jobs in California are generated by the university, 1 in every 45, according to the 2021 Economic Impact Report. And if you don't know, we're the state's 3rd largest employer. We're also a land-grant institution. So the purpose of a land-grant university is to provide readily available research-based programs and educational resources with the goal of improving the lives of individuals, families, and communities within the state. And that's the core of what the University of California is, and it's the foundation in which we were established. So there's tremendous potential power of both the economic infrastructure of our 10 campuses and our 6 academic medical centers to supply opportunities for the most under-resourced BIPOC communities in the state by transforming how UC approaches workforce development, how we do procurement, how we think about capital investing. So by collaborating and collectively working together, we can create more sustainable jobs that pay fair wages. We can support more robust local economies. We can shrink California's wealth gap and lead to improved long-term health and social welfare. The Anchor Institution mission will shift our culture and reframe our economic development with an equity lens, which is really, really important. And I'll just say something that President Drake really believes very strongly in. This work requires commitment, intentionality, and persistence. UC exists really to do this kind of work for the citizens of California. And I'm really excited to be here with all of you today to think about where we can go from here and how we can encourage all of our UC colleagues to join us in this effort. I want to personally thank the organizers for putting on this event and inviting me to be part of it. We all need to remember and remind ourselves every day that we are here to serve our communities and the great state of California. And I'm really looking forward to hearing about the innovative work that everyone is doing to help us achieve this goal. So I think that's enough said for me. I'm really excited for us to get started with the agenda. So with that, Michael, I'll turn it back to you. Thank you.
Thank you for those remarks. And I think it's always a helpful reminder of why we're here and why is it important to serve through an equity lens. So we really appreciate that. We appreciate your time, Rachel, and really excited to jump into the agenda. And so with that, I have the honor of introducing our keynote, David Zuckerman. He is the president and founder of the Healthcare Anchor Network, which has brought us all together under this strategic alignment. David has been leading the Healthcare Anchor Network since its launch in 2017 and serves as the president of the network. He is a national thought leader on the role of health systems as anchor institutions in building community wealth and inclusive economic development. David is the author of several reports as it relates to the Anchor Network and its movement and its impact on hospitals and health systems and organizations across the country. David has been invited to speak at various renowned organizations like the World Health Organization, American Hospital Association, Association of Academic Health Centers, the National Academy of Medicine, American Organization of Nurse Executives, and Modern Health Leadership Summit. And so David will be an absolute treat for us this morning. And so please all in the chat, welcome David Zuckerman.
Thank you, Michael. Really a pleasure to be with you all. And I think a lot of my remarks are going to build on what we just heard. And I think Rachel and I are on the same wavelength on a number of things in terms of our passion for this work and the belief the UC system can play as an anchor, but also in bouncing back from a head cold. So I too have that as well. And I might at moments turn my camera off if I need to cough, but I promise I'm not going anywhere. I'll be right back if that happens. So I'm going to share my screen and jump in. And so I know that today was really many years in the making, and just excited to be able to join you. Was privileged to be part of some of those early conversations 7, 8 years ago when this concept was just getting started on some of the campuses, and just delighted to see how it's evolved, and really excited that this is happening a week before our annual convening, which will be on the UCLA Health campus next week. And I know that I'll have a chance to get to meet many of you in person there, and just excited to dive deeper into conversation and partnership with all of you then. So I hope to accomplish a couple things in my remarks. I think I'm going to reinforce some of the things we just heard in terms of grounding in shared language for what we mean by the anchor institutions and anchor mission. I want to share some additional perspectives on what I think is the imperative for this work, and then provide a few additional things for you all to keep in mind as you dive into the strategies that you seek to pursue around this work, and the opportunity and challenges you have in implementing this work both at the system level and on the different campuses around the state. So before I do that, I did want to just recognize a few trends that are occurring across the country that I think have laid the foundation for this conversation today, as well as the internal conversations that you've all had to get to this point. This was an article in the New York Times a few years ago, really illustrating how health systems around the country are recognizing the root causes that drive poor health in our country, and really understanding the racial and economic disparities that are at the center of that, and thinking differently about what tools they might have to begin to address some of those conditions more broadly in their community. And this was actually focused on some work that was happening in Los Angeles, this article in particular. Another article in Modern Healthcare, which is a prominent trade publication for the healthcare sector, was really focused on how health systems are beginning to shift resources related to this work. And this was related to a commitment that we helped organize at the Healthcare Anchor Network, and really making a statement for the first time around the opportunity that health systems have with the idea of impact investing, and what it can mean for going upstream and leveraging resources in a different way, especially during difficult financial times. And then just last year, we put out a new white paper on deepening the imperative for higher education's anchor mission. And most of my remarks will really be around the role of healthcare. That is our primary focus at the Healthcare Anchor Network, obviously given our name. But this work around the role of anchor institutions actually begins within the higher ed sector and goes back beyond, goes back beyond the work in healthcare. But I think in many ways, the work in healthcare has surpassed a lot of the efforts around anchor institution efforts within higher ed. And there was an opportunity to kind of take a step back and re-articulate that our imperative for higher ed. And I think between this imperative for higher ed and the clear imperative within healthcare, the UC system, given some of the statistics that Rachael shared and that I'll reiterate in a moment, really just underscore the opportunity that the UC system has to drive this work within the state of California. So just to take a quick step back, not to spend too much time on definitions, but what are anchor institutions? Why do they matter? From our perspective at the Healthcare Anchor Network, an anchor institution is an economic engine that has an embedded social mission. And the combination of those two factors and and that institution often has a large investment either in a fixed plant or its customers are nearby, and just broadly its mission, create an opportunity and a more inextricable link to the place in which it sits. And we've seen this most commonly referred to as the eds and meds. Rachael talked about local government. We also see local government, state government as anchors, and other actors within the communities. But it really creates this opportunity for these institutions that are unlikely to pick up and leave to think differently about how they want to leverage their everyday business practices towards improving the health and well-being of the community and addressing deep-rooted inequities. And that for us is the anchor mission. The anchor mission isn't necessarily an end state. It is a North Star for how to be more intentional and to orient an organization towards thinking differently about the assets it has. So often healthcare in particular is very deficit focused in terms of how can we bring a lot of resources to address a clear deficit that's identified. But this really takes a page from the community development sector and communities that frankly have a lot less resources to think much more from an asset-based perspective. How do we look at what we have differently and apply a lens towards how leveraging those things can drive greater social impact within our communities, and to focus specifically on the economic power we have, but also over time, the other assets and resources that we have as well. And I think the reason that we need to make this shift is because we know how deeply rooted inequities are in our communities. And we heard a little bit about the inequality within the state of California that often boils down to differences in life expectancy between communities just a few miles apart. This is a slide of Cleveland, and it's not to pick on Cleveland, but I think it's to help reinforce how the difference in life expectancies can still occur in neighborhoods that are proximate to world-renowned health systems. In this case, the Huff neighborhood, a predominantly African-American community, low income, is situated next to Cleveland Clinic and University Hospitals, two world-renowned health systems, and just 8 miles down the road from the Lyndhurst community, which is affluent and predominantly white, and shows that even in this case, that the county with the lowest life expectancy can be situated just next door to healthcare systems. And I think for me, it really then asked the question of like, how do we begin to think differently about the role that institutions have in our communities and what they can leverage in service of addressing the community conditions that have created these disparities in the first place. One other way to think about the anchor mission and how it complements the many other things that healthcare and universities are doing is obviously healthcare is very focused on the downstream, on the clinical care, and that will remain its primary focus. Over the last decade, we've seen a shift to the midstream. How can we address individual social needs that influence one's ability to be healthy? For example, transportation subsidies or food subsidies, et cetera. But many of those are really band-aids on systemic problems and don't begin to address the factors within the community that prevent individuals and families from having equitable transportation or equitable access to healthy food. And the hope here is that with the anchor mission approach, we can start to look at other parts of the organization that might be able to be leveraged towards creating that sustainable infrastructure and ecosystem within the community over the midterm, and begin to connect into the conversation our largest institutions around inclusive economic development, which has historically not been the case. So I think another way to articulate this is also to think of not anchor mission as another thing. Your organizations have many priorities as they are, but our hope, or my hope, is that this concept connects the dots between many of those that are often working in silos. How can this link efforts around diversity, equity, inclusion, and belonging with community health and health equity, with sustainability and ESG, and then also employee and community engagement? One of the things that has most surprised me, but I think in a really beneficial way, is talking to other C-suite executives at health systems around how this has really been an energizing force for their staff to get engaged in this work. And that is a really important differentiator, especially at this moment in time in which there is significant burnout and retention is such an important priority. So I'm going to just take a step back to introduce who the Healthcare Anchor Network is and how we hopefully can support you all on your journey. But just to kind of reiterate what I think is both the imperative and then for this work, in the sense that the UC system is the third largest employer in the state of California. And that's only behind the state government and the federal government. And so, you know, we might think of Kaiser, we might think of Google, we might think of Facebook, but it's really the UC system that is up there as the largest employer, just behind government. And I think that when combined with the public mission that we heard that you all have, and how that really traces back to the roots of you being a land grant and the economic development imperative that was part of the founding of land grant institutions across the country, and the increasing focus on equity and how that can merge with this history and this public mission, and just in general, the broadening focus on community health and understanding that we need to go upstream. And so I think those all create the imperative from a mission alignment perspective for why this is really critical for the UC system to go further on their journey around anchor mission. But I think in terms of the other pieces of the burning platform, you know, California for the first time is facing a stagnating population. There's a back-breaking cost of living across the state. The state has 1/3 of all the unhoused Americans in the country. Climate change is increasingly impacting the state up and down the coast. And we heard a bit from Rachael around the inequality that is present in the state. And so I think putting both sides of that on the ledger is really important to thinking about why this should be a priority and more deeply integrated and embedded into the role and mission of the institution over the coming years. So just quickly stepping back in terms of the Healthcare Anchor Network, where did we come from? We started as a conversation, really asking the question around how can this be more systematic at health systems in terms of adopting these initiatives? How do we go beyond a good project here and there that is disconnected from an overall strategy? And coming out of that meeting that we had in late 2016, we formed the network, and we more recently spun off as an independent 501c3 in early 2022. But we grew from that 11 co-founding systems to 75 today. UCSF was with us at the beginning there in joining in mid-2017, and we're delighted that many campuses have joined over the last few years and look forward to continuing to support them and the system as a whole in this work. Very briefly, in terms of our role, we want to help you all leverage your hiring, your purchasing, investing, and other assets to create economically and racially equitable local economies. What is the institution's role in creating economic opportunity, inclusive economic development, and community wealth building, which I'll define in just a minute. And really getting at this idea of fully activating the potential of the institution as the community asset that it was intended to be and that it is. And you've all been on that journey. And my hope is that this frame, again, is just an accelerant and an aligner of the work that you all are doing. What do we do at the network? Just very briefly, we help to articulate what we see as best in class across the country, working with institutions that have been deeply committed to our core strategies to help really name what it means to be at the vanguard. And so we've, at this point, released 3 leadership commitments around impact investment, supply chain, and workforce. I know that there are going to be panels on those in a little bit, so I'm actually not going to spend a lot of time talking about those 3 areas. I'm going to focus on maybe some other things that can go in addition to those core strategies that, from my perspective, are essential and really are the foundation of this work. And that's why we've focused our leadership commitments in that area. The bulk of our activities in the Healthcare Anchor Network are really around accelerating adoption through a variety of tools and resources that I'll touch on in a little bit. And then lastly, we seek to foster unique sector collaboration where we can in order to really build the movement for this work and also create a robust body of work that institutions across the country that want to pursue this can draw from. In particular, I'll talk about our data collection and our work around collective federal policy advocacy. And then you saw the annual convening, and I excited for the representation that many of your campuses will have and systems will have at our convening next week. So fully activating healthcare as a community asset, hiring, purchasing, place-based investment. Those are the core strategies we focus on. You all will hear about them from your peers in a little bit. I want to touch on in particular these secondary set of strategies that as you deepen your commitment to this work, you may want to consider bringing those within your organization that might be focusing on them to the table or thinking about how they're additional pillars to your approach over time. In particular, policy advocacy, and it says real estate, but how you can build for impact as you expand your campuses or think about vacant land in your communities. Before I do that, I did just want to spend another minute on a definition, defining a phrase that's very important to us within the Healthcare Anchor Network around community wealth building. And so much of economic development in the US and in cities, states, et cetera, is really focused on regions. And a lot of that's critically important, but embedded in that approach has been a belief that the benefits from only focused on the region or attracting large employers, that will trickle down, that will benefit neighborhoods that have been historically disinvested and discriminated against. And we don't hold that belief. We don't think the evidence supports that conclusion. And that if we really want to get at disrupting intergenerational poverty and a legacy of discrimination in many of our communities of color and low-income communities, we need to be more intentional with how we get at place, how we think about building models for broad-based ownership and wealth creation, how we focus on the multiplier effect that comes from each dollar we spend and how that can circulate in communities more intentionally, how workforce training really does result in jobs at the end of the pipeline instead of just more training, and how we do that with an equity, collaboration, and systemic approach. And so that's really at the heart of community wealth building for us. And when I talk about it, it's really looking at some of those strategies that are getting at more innovative models for keeping wealth within communities, and really get at why we focus on certain strategies within the Healthcare Anchor Network around local purchasing, around supporting things like employee ownership or community land trusts or other models that really try to balance that tension between people and place that's so front and center in doing this work around inclusive economic development and community wealth building and creating economic opportunity. So just very briefly, wanted to touch on one of these strategies, building for impact, before I talk about a few other things. and that this is something that we're seeing increasingly be something that systems are focused on, which is recognizing that when they expand a facility or when they have sufficient, extra vacant land, or when they recognize there is vacant land in their community, how can they be a catalyst for putting that land or adding amenities to their expansion in a way that really is meeting community need and addressing some of the community conditions that we've been talking about so far. One example I just want to give on this that I think is really gets at what this could look like is Trinity Health System in Atlanta. And they have been operating in FQHC, and over the years, they've required some land to expand that FQHC, and they could have just done a traditional expansion of their healthcare clinic. And instead, they saw an opportunity because the neighborhood that they were situated in, the Fourth Ward, which is where MLK used to preach, was rapidly gentrifying, that they wanted to do more. And they wanted to really address some of those challenges that were beginning to become present. And so they went through a plan of including 200 units of affordable housing, almost 200 units, as part of this expansion effort. And what was interesting about it was it wasn't simply they provided a grant or an impact investment. They really looked at, okay, we can be an anchor by acquiring the land, we can provide an impact investment, and then we can provide a little bit of grant money to make the project work. And I think that integration of many of these strategies is a really exciting opportunity that as you all go down this path on your journey, really opens up a lot of opportunities for how to be really a positive actor in the local ecosystem. So much of this work is adaptive. It's not one size fits all. It's not a technical problem that needs, has a very specific intervention. It really is, what are the resources we have, and what are the tables that we need to be at where we can be responsive with the resources we have when the moment presents. The other way I wanted to talk about that is around policy advocacy. And this is an area that when we started in the Healthcare Anchor Network, we were focused on what can health systems do with their own behavior. And then we quickly realized and learned and saw an opportunity for saying, okay, in addition to the changes that we're talking about here around hiring, purchasing, investing, building for impact, whatever it may be, there's also a opportunity to use your voice differently. In particular, being such a large employer, when you meet with policymakers, they listen differently. They listen differently to other community-based organizations that have far less resources and a less powerful voice. And we wanted to be very intentional on what are the non-clinical issues that we can provide unique value add around the Healthcare Anchor Network. And so we support all of our members with resources to do this work better at the congressional level, specifically around affordable housing and workforce development. Those are the two areas that we've dived most deeply into, that we think we can provide a unique perspective on, and that we can add the most value to the existing coalitions in the affordable housing space and the workforce development space, and that healthcare's voice can have the most impact in a positive way to advancing those conversations. And they also really closely align to our three core strategies of investment and workforce development. So I did just want to share that as you go down this journey, thinking about what is also the UC system's role in policy advocacy. We support our members to do that work at the federal level, but there's also that opportunity to think at the state and local level, especially around some of these thorny issues that stem to issues of affordability within the state. One example that I want to share how one of our systems is pushing this work at the local level is UMass Memorial Health. And they really had no history of approaching policy advocacy in this way until they had joined the Healthcare Anchor Network and started to recognize that policy advocacy could be part of their strategy differently. And as part of the discussions around ARPA funding, they joined a coalition that you can see in the lower right-hand corner to make the case that for the first time, Worcester, Massachusetts, the second largest city in New England should create an affordable housing trust fund. And what councilperson said was that having UMass Memorial Health at the table was really essential to helping convince them that they should be using their dollars in this way, and that the system helping make the case around affordable housing and health outcomes was a really important part of the conversation. Switching gears a little bit, I did want to name just two other things related to this work. One being that the Healthcare Anchor Network, we also support our members in setting baselines, benchmarking, and tracking collective progress. As you go down this path, really encourage you all to think about what are the baselines for the strategies you are pursuing. That we really can't move the needle unless we have the data around these strategies. And a lot of our work at the Healthcare Anchor Network has been about helping our partners to have a standardized set of metrics that they can track as it relates to these core strategy areas of hiring, purchasing, and investing. From there, we hope that we're able to provide benchmarking. One thing that we're excited for, as more campuses submit this data to the network, we can provide benchmarking just for a subset of the UC system, which I think will be really exciting to helping you all in your journey. And then ultimately, how are we tracking our collective progress through this data? Like, are we making a difference? Are we actually moving the needle as it relates to our workforce pipelines, our purchasing, and our impact investments? We also have a number of resources that for those excuse me. We also have a number of resources for those campuses that are just joining this part of the journey. That this is a way that what we've seen from working with other members to really do an inventory. What are we already doing? Many of your campuses are doing something. They might be doing a lot of this. Where are some of the areas where we haven't really considered historically that we might want to build into our strategy? And how do we name this work? So I think part of today is really about naming this work and making it clear as a strategy. And hopefully these self-assessments, which are available to anyone on this call, we're happy to share in the post gathering materials, will help you all as you think about your individual strategies as campuses. And the last message that I just want to leave you all with is, what does it mean to at some point take this beyond your individual campuses and health systems? I think a lot of today is about, and a lot of the anchor mission concept is, how do you get your own internal house in order so that you can be a better partner externally, and that you can bring new resources to community level problems that historically haven't been something that institutions have considered leveraging towards solving those issues, and how to do that with a level of intentionality. That really, I think, is the core of the anchor mission concept, and really what I think this conversation is about today. But over time, we know that no one institution can solve these complex community issues that we see around economic and racial disparities, and that it really will require coalitions of committed anchor institutions and other socially minded corporate actors to think about how to build this into the ecosystem in the way that it's not something that happens by accident, but something that happens as a result of the way the local economy works. And we're not there, and that is the long-term hope that we can get to with these changes of behavior that we're talking about. What's exciting, though, is that we are seeing across the country that anchors are coming together at different tables to think about how to take their individual strategies to scale, whether it's Chicago or Wisconsin, Massachusetts, or Utah, big and small cities alike. And there's an organization that really steps up as the backbone. It might be a local government, it might be a university campus, it might be a health system, it might be a new nonprofit. It looks different in different communities. But ultimately, it exists to help bring together multiple institutions to begin to think about what can they individually commit to, what can they collectively work on. And I think that's an opportunity down the line for you all as you think about your role in this work, not just within your own campuses and within your own health system, but really as an actor in the ecosystem, given your positioning as a public institution, as really such a prominent employer in the state of California. And I think the last thing is that the thing that is really interesting to me from this conversation is how can the UC system office, whether that be a backbone within Oakland or backbone for this work across the state, how do you really leverage resources at the system level while really allowing the local knowledge of the campus level to move forward these strategies? And I think the opportunity here is that you have such a unique structure to balance that local campus knowledge with that system-wide set of resources. And you also have some of the challenges that come with being a public bureaucracy. So I wish you the best in moving forward that and helping innovate and really thinking about how to bring the strengths of both, the strengths of system resources and the strengths of local knowledge to this work. And I'm excited to continue to support you all in the journey from our vantage point at the Healthcare Anchor Network and to really hold up the story of this work moving forward in California. So thank you for the time. Really appreciate the opportunity to join you. And I will pass it back to Michael.
Thank you, Dave. But before you go, just really quick, there's a question in the chat. We will make the recording available for all participants. But Dave, I wonder, is there a possibility for you to share this slide deck with us as a teaching point for the anchor missions and then any of our pop health instructors that would like to inform their students on how population health is advancing in a modern health system?
Of course. Yeah, happy to. And we have plenty more. So feel free to take all we got.
Okay, thank you so much. And just again, thank you, Dave. Thank you, Rachel. We know you're both under the weather a little bit, and we just appreciate your commitment to this work, your commitment to serving. And just to reiterate some of the points that were shared by both, just recognizing the strategic priorities of community health and health equity as it relates to our business goals and how that intersects with diversity, equity, and inclusion efforts, sustainability, employment and community engagement, but then ultimately how those serve as foundations to drivers for community wealth building, and community wealth building really meaning a place, ownership, inclusion, system, workforce, collaboration, and multipliers. And then lastly, you'll hear from all of the panels about impact purchasing, impact investing, and diverse hiring. So really excited about the rest of the agenda. And without further ado, I would love to introduce you to our next facilitator who will introduce our panelists, Lynette Issei. Lynette Issei is the Senior Director of Strategy and Operations, Health Justice, Equity, Diversity, and Inclusion at UC San Diego Health. Well, welcome, Lynette.
Thank you, Michael, and good morning, everyone. And I'll kick us off this morning by introducing our panel members. First, we have Dr. Medell Briggs-Malonson, who is the Chief of Health Equity, Diversity, and Inclusion for the UCLA Hospital and Clinic System, and the Associate Professor of Emergency Medicine at the David Geffen School of Medicine at UCLA Health. Next, we have Dr. Howard Pinderhughes, who is a Professor and Director of the Sociology Doctoral Program, Department of Social and Behavioral Sciences at UC San Francisco. And then we have Dr. Hendry, who is the Associate Vice Chancellor for Health Equity, Diversity, and Inclusion at UC Davis Health. Welcome to all our panelists. Good morning. Thank you for being here today and taking time out to share your institution's journey with us. So if I could start off our panel by asking each of you, perhaps in the order that I introduced you, what prompted your anchor institution mission journey, and why is this important to your organization?
Well, thank you so much, Lynette. I guess I will go ahead and kick it off. And first, I want to really sincerely thank all the organizers of this summit. I remember when we all first started talking about it, and I give kudos to organizing and implementing such a wonderful convening of all of the UC campuses for us to really align in our work to continue to advance our anchor institution mission. So as Lynette mentioned, my name is Dr. Medell Briggs-Malonson, and I am the Chief for Health Equity, Diversity, and Inclusion for the UCLA Health System. And I can tell you why we started on this journey with the Healthcare Anchor Network. During the pandemic, as well as the social justice movement, UCLA Health decided that we had to recommit to our journey to advance health equity to achieve health justice. But one of the things when we're thinking about how do we advance health equity to achieve health justice, it's really important to recognize that our poor health outcomes are a direct cause of both historic and contemporary injustices rooted in racism and classism. So as I came upon as the chief for health equity during that time, one of the things that was very important to not only me, but the rest of the organization was to continue to think about those histories of disinvestment, discriminatory policies and practices, as well as intentional exclusion that has disproportionately impacted communities of color and definitely low-income communities of color, which has then resulted to both health, education, and social inequities that we continue to see today, and sometimes even worse than what they were generations in the past. And so if we were going to truly make sure that we as an organization were intentionally marching towards health justice, we had to think about things outside of our four walls. It wasn't enough just to think about what's inside of our emergency departments, clinics, and hospitals, and how we can provide, for instance, equitable care. It was important for us to address those histories that existed within our communities throughout not only Los Angeles, but throughout the country. So when we're thinking about how to do this, and how to do this in the most strategic way, we were introduced to the Healthcare Anchor Network. And I initially was very, very impressed by all the work that was going on already across the country, and really all of the healthcare systems leveraging their assets to directly address both racial and social economic inequities. And so there were three reasons why we joined the Healthcare Anchor Network in January of 2022. And so we are also one of the newest UCs to the network. But the three reasons why we decided to do so is that joining HAN actually provided us the ability to be intentional with our organizational strategy in order to address racial and social economic inequities. So often we all want to do something that's really great, but it's not integrated within the organization's priorities or practices. And this structure directly through the Healthcare Anchor Network, and then of course, as we develop UC AIM, it actually allowed us to do so. One of the second reasons why we decided to move forward and especially commit to being an anchor institution is that we had to and recognize that we had to develop new solutions that address all of the various different social structural drivers of health. Because when we think about what contributes to overall health outcomes, we have to ensure that our communities have economic opportunity, have economic growth. We have to make sure that our children and also our adults have the opportunities to gain the highest level of education possible so that they can continue to thrive and also achieve the best life that they can live. And we have to think about all of those other environmental factors that we know play a significant role in one's overall health outcomes as well. So it's not just going to work with us, again, just staying within the four walls. We had to really start developing solutions that can directly influence and impact all of the various different factors that we know contribute to overall well-being. And then one of the last reasons why we joined the Healthcare Anchor Network, and which we knew it was the right step for us to do, is that there is strength in numbers. And we already heard Dave just now mention the power of collectives and collaborations. And so we had already seen our UC sisters, both UCSF and UC Davis that we're already part of HAN, as well as many of our other sister organizations across the country. And we knew that by partnering, that we would be able to not only share best practices, but also learn about what's worked in different areas of the state, what's worked well in different areas of the country. And then as we come along and as we start to create our own initiatives, which we have already started to do and share, that would be a nice wealth of knowledge for us to continue to address all of these historic inequities in our country. Because I agree completely with what Dave said, none of us can do this alone. And none of us should do this alone. And it takes all of us together to really start marching towards where we can really achieve the health and social justice that we need within this country. So these were some of the reasons why we as UCLA Health took part in the journey to become an anchor institution mission. And I'm very proud to say that because of the initial work that we started with just exploring how we can be an anchor institution, our methodologies have actually now led to our institution even thinking about where we place our clinics, where we're placing our dollars, where we're actually recruiting from for our workforce, how we address environmental justice, and also how do we continue to expand our community partnerships, because it's not about us going into a community and saying, hey, this is what we think you should do. It's about us partnering with community and saying, how can we as UCLA help you? How can we as the UC system help you? And what can we do to continue to help to expand all of the strength and the assets that you have in your communities? So this is just a summary of why we joined and where we are on our journey. And this is just the beginning for not only UCLA Health, but I really look forward to what we as a collective UC Health system and UC system overall will do to transform the communities of not only California, but also be that beacon to help transform the communities throughout our country. So thank you, Lynette.
Thank you so much, Dr. Briggs. So much for us to consider at our individual institutions. And I know UCLA Health has done so much in a short space of time, which we will hear more about later today. So Dr. Pinderhughes, can I ask you to answer the same question, please? What prompted your anchor institution mission journey, and why is this mission important to your organization?
Yes, I first of all want to say that I am extremely heartened by this meeting. I've been on this journey for the last 10 years. At the beginning of its inception on our campus, when it was just an idea in a couple of our eyes, and to see it reach this point really gives me a tremendous amount of hope for what we can do within this space. Now, the reason why UCSF has embarked upon the Anchor Institution mission is quite simply, it is the right thing to do, and it's really the only way we have the actual possibility of having an impact on the social determinants of health, which impact communities of color and highly impacted communities across the Bay Area and across the state. And so 9 years ago at a leadership summit that Dr. Talmadge King convened in the School of Medicine, I laid down a challenge to our faculty and to our administration that we had the opportunity to transform the way we did business and to transform the way in which we impact the health and well-being of underserved communities in the Bay Area, and that the Anchor Institution model was what we needed to lean into, and what the props to my chancellor and to my entire faculty and university for leaning into this idea and really taking it on and making it a part of the fundamental core mission of this institution. That's what it's going to take in order for this to be what it needs to be, which is a transformational strategy to improve the health and well-being of underserved communities. Now, I want you to just go back just 3 years ago when we were in the pandemic, when we had what we have come to call the Summer of Racial Reckoning, and that every single institution across this country came up with grand proclamations for the need for transformational change to improve health equity and health and reduce health inequality. The anchor institution model and anchor institution mission, which we had already embarked upon, it positioned us to be able to actually do what we said we needed to do, which is to create transformational change. And for what we've done over the last 5 years is to put in place the infrastructure to move forward this mission and actually have a deep and lasting impact on communities of color in the Bay Area. Now, what does that fundamentally mean? It means changing the culture and changing the way in which we do business in this city. Now, we recognize that we are the second largest employer in the city and county of San Francisco, second to the city and county of San Francisco. That means what we do matters and how we do it matters. But also what it means is we can be a beacon, we can be an example, we can be a challenge to other corporate and nonprofit potential anchor institutions to step into this space and change the corporate culture of the entire Bay Area. That's the vision. The vision is that we not only change the way we do business, but that we help to change the way our entire regional economy is organized to help provide opportunities and to help improve the health and well-being of communities of color around this country. We're going to hear from a number of the different subcommittees that we have at UCSF about how we're embarking upon doing this. My role today is to tell you that this is truly the one way we have to do what we say we're about. UCSF, we say we're advancing health worldwide. We've decided over the last 6 years that worldwide includes our backyard and the communities of which we are a part, and that we are committed to using the awesome economic infrastructure of our institution to provide those types of opportunities and to really make a difference in terms of how health equity proceeds in the Bay Area.
Thank you so much, Dr. Pinderhughes, and thank you for sharing that vision. I think it's something for each of us to consider locally. And I really appreciate how both you and Dr. Briggs are thinking about this locally, but also calling for a more system-wide cohesive strategy from the University of California. So I'd like to ask Dr. Tan to please weigh in on this and share his institution's journey with us. So Dr. Tan, if I can ask the same question, please, what prompted your anchor mission journey and why is that mission important to your organization at UC Davis?
Absolutely. And I just want to first say it's wonderful to be in this panel with our two illustrious panelists. I'm a fan of both of you all. And really great to see that we've gathered here to talk about anchor institution mission. I'm gonna I agree and with what was said before. We are really trying to fight poverty and structural racism and inequities, and we can't do that just through a stethoscope. We need to do that through our economic engines and our practices system-wide. I'm going to take this from a clinical standpoint. So I'm a psychiatrist, and I see a lot of patients who have problems with post-traumatic stress disorder and insomnia. And I had this patient who said to me one day, "Dr. Tan, I can't sleep. I can't sleep because I'm afraid. I'm afraid that where I'm staying at, if I fall asleep, someone's going to break into my house and hurt my family and me." Now, the classic thing that we would do in psychiatry is we'd say, well, let's take a symptom checklist. You have insomnia. Let me give you something for your insomnia. But doing that actually would just would dishonor his experience that, he's trying to stay awake because of the danger in his living situation. And for us to prescribe a sleeping medication really says you don't deserve to be concerned about your welfare. And so what we did was we gathered up funds and helped him to move to another place. We provided cultural brokerage because he didn't speak English. We found a place and he was able to move there. And for the rest of the time that I worked with him, he would bring in, every year, he'd bring in a pepper plant that he grew in his front porch because he felt safe to do so. Was that a success? I thought it was a success, but it actually wasn't a success. And the reason why is that I moved him out of this neighborhood, but what if he had family in the neighborhood? What if he had friends in the neighborhood? What about the other folks in the neighborhood? And what about his contributions to the neighborhood that now he's unable to do because he doesn't live there anymore? And so really, our hands are tied when we just think about it from a clinical standpoint, even though we do our best and be as innovative as possible. But if we look at our ability to address racism, poverty, violence through just a clinical lens, then we end up fractioning our neighborhood. And so really the anchor institution mission is not about moving people out of the neighborhood, but it's about moving resources into the neighborhood. And that is the long-term strategy. So at UC Davis, we're expanding very significantly. We've got multi-billion-dollar projects in construction. And the concern that our neighborhoods have is this going to be what it's going to be across the country, which is universities and health systems gentrifying our neighborhood and removing us from our neighborhoods, edging us out? Well, the anchor institution mission is our commitment to making sure that as the UCs, as we grow and as we do our good work by growing, that we also remember that our neighbors, our partners, our communities grow with us. And that is an important commitment that we all have to break down that boundary between the ivory tower and our neighbors and communities. We have an ethical obligation, and it's part of our mission as a land grant institution. When we think about addressing health, only 20% of health is done at the level of the office within, as Medell said, the four walls of our clinic. It's the other 40% that we can move around when we actually focus on addressing the social and economic determinants of health. The final thing I'll say is that, I think the UCs have incredible faculty, students, and staff that do community engaged, community partnered work. But the challenge of this is that people are wondering what UC is doing, not what our faculty are doing, not what our students are doing, but what our UCs are doing. And so the anchor institution mission is our way. It provides us with an institution-wide way of answering that call of what have you done for me today from our neighbors. And it's not that, oh, we have a faculty that's working on this project, or we have student-run clinics that are doing this. It is, we are committing our resources for as long as that we are here in this neighborhood, which is in perpetuity, that we are committing to a long-term relationship with you that goes beyond project, that spans longer than any grant, that is more than any one individual. It is an institution. And that's what we need to really catalyze and be part of the transformation that we've been talking about. It takes a long-term commitment that is beyond the lifespan or life cycle of any individual leader, faculty, or student. And that's what our anchor institution mission enables us to do. It enables us to commit as an institution to long-term partnership with our neighbors.
Thank you so much, Dr. Ton, and thank you for sharing your journey so powerfully with us. I really enjoyed how each of you, in your own way, hit on the fact that one of the reasons that each institution is engaged on this anchor institution mission journey is because it's not only an ethical obligation, but it really is the only way that we can fulfill our mission, both at our own locations and then, of course, system-wide. I want to thank each of you so much for your time today. We really appreciated hearing about your journeys. They are inspirational, and we hope to learn lessons from each of you as we embark on our own journeys at our own locations, and that we can work very closely with you from a system-wide perspective. Next, I'd like to introduce our next panel, which is on the community investment. And this panel will be facilitated by Wiley Liu, who is the Executive Director for the Center for Community Engagement and Anchor Institution Mission at UC San Francisco. Wiley, over to you.
Thank you so much, Lynette. That was such an inspiring panel. So everybody, hi everybody, good morning. I'm Wiley Liu. As Lynette noted, I work at UCSF and serve as the Executive Director for the Center for Community Engagement, as well as our anchor institution mission. I am thrilled to have two panelists join me to have a conversation around community investment and share their insights. Victor Rubin, as you can see here, is a former Vice President of Research and a Senior Fellow at PolicyLink. I would also add that he serves on the UCSF Community Investment Subcommittee as our Community Partner Co-Chair. I should also note that his UCSF co-chair, Shannon Turner, who is our controller, unfortunately is unable to join us this morning. However, we're excited to have Michael Whittier, whom you have just heard from, join us from UCLA Health. Michael serves as a Director of Health Equity, Diversity, and Inclusion. Thank you so much for joining, Victor and Michael. So I'd like to start by creating some shared language around what we mean by community investment. Of the three strategies that we are discussing today, this is probably the most confusing because it's not a standard practice for UC campuses. I think it's safe to say that UCSF is not only the first UC but also probably the first public academic health system nationally to pilot a community investment initiative. And I'm super excited that UCLA is going to be joining us in this effort. So what do we mean by community investment? Community investment refers to the practice of directing capital to under-resourced communities, supporting efforts such as local businesses, and promoting social and environmental initiatives. It seeks to create a positive impact on local communities while generating financial returns for investors. I want to emphasize generating financial returns for investors. So in short, we are not talking about grants. We're not talking about the traditional community benefit we do as nonprofit health system. So that's what we're talking about. I want to note that while many of you RSVP'd for this event, we asked you to provide questions for us to respond to. And I would like to start by posing a question one of the participants asked, which is, how did UCSF and UCLA get started on the community investment strategy? And I'd like to invite Victor and Michael to reflect on who are the champions that helped with the process. What are some specific goals and objectives of your strategies? And how are community members and stakeholders engaged in the process? With that, I would maybe invite Victor to start your reflection.
Oh, thank you so much, Wiley, and thanks to all the organizers of this event. And just as a quick point of personal privilege, it's not only for me gratifying to see how far UCSF has come in the 7 years I've been involved in the Center for Community Engagement, but I began working on community engagement at the University of California in 1986 at Berkeley, and have 25 years in the system one way or another. So this is really gratifying and rewarding to see in many other respects as well. And when I left in 1998 as an adjunct associate professor, I would not have expected that we would be where we are. So this is tremendous. I think that Professor Pinderhughes gave a good introduction to that origin story in his remarks, and he's one of the main champions on the faculty who helped push the institution and always, along with the other members of the board of the Center for Community Engagement, make sure that we were both being idealistic and practical at the same time. The background report by San Francisco State University researchers on what the anchor mission could look like reflected the voices of the communities in San Francisco, particularly the underserved Southeast communities of the city. It talked about the possibilities in the three legs of the stool that everyone has spoken about in procurement and supply chain and workforce development and in community impact investing. And it began to link it began to show how a scattered set of programs on the campus could turn into something much, much more. But no matter how big and bureaucratic and complex and wealthy a university system gets, frankly, it's still the faculty that can be the drivers for change. And Naomi Waters and Kevin Grumbach and Howard Pinderhughes and the others, I give them a ton of credit for moving this forward in that way. But it really was the pressure from those communities, deeply dissatisfied with what they had seen of the university, that created the momentum that allowed the system we're talking about today to evolve.
Thank you so much, Victor. Michael, would you like to chime in?
Certainly. Thank you, Wiley. And we have precedent. And I think that was the easiest aspect of our journey, which is we had the opportunity to look to UCSF to say, what can we do? What are the possibilities? And so the first steps for us in this journey was to really understand what we were trying to accomplish. And Dave Zuckerman outlined the drivers of community wealth building. And it was really just socializing those tenets as we really sought to better understand the anchor mission, what it meant to be an anchor institution. And so we built this case amongst our executive leadership. We shared evidence of why this is important, but not only why is it important, but how is it impacting us financially as well. We hear a lot of time about the moral case as it relates to anti-racism and investment into communities, but there's also financial implications. We are a public institution, and so thinking about the tax revenue that is generated from income tax and how that also funds our institutions is pivotal in this conversation. But then also as healthcare organizations, we know that deeper investments and moving upstream as it relates to social drivers of health have proven to improve health outcomes. And so taking that deep investment also has long-term implications on metrics that we track very closely as it relates to the quality of care we're providing, like length of stay, like readmissions, and other chronic health management metrics. And so for us, it was really making sure that we understood the implications for how investing impacts us internally, but then also the significant impact it could have on our communities. And so we really pulled together our senior leadership in various business units across the organization. And as mentioned, socialized the concept of the Healthcare Anchor Network, really spoke to examples of investment that is happening here within our state with UCSF, but then also around the country. Had conversations with our business development team, our strategy team, and really had to start to navigate a conversation on, okay, this is important important to us, but now how do we do this given the status that we're in as a country as it relates to our economy and the impact that is having on us financially within our respective institutions. And not only that, recognizing the social unrest that was occurring, but then also the implications of the pandemic and CARES Act dollars drying up and the headwinds that were before us. And so we began to think very innovatively around how can we pull partners together now that we have an understanding? How can we build some strategic momentum to engage in a conversation around investment at a time that is really unprecedented for many different sectors, not just healthcare, but then also how can we move forward in a way that has some tangible outcomes, tangible next steps, so that we are progressing in a way that we are living out this mission and not allowing the status quo, not allowing the environment to dictate how we decide and develop strategies that are important to driving health and well-being of our communities. And so all of these factors were taken into consideration as we began to outline what and how we were going to think about investing in our communities. And you heard Dr. Briggs mention in the last panel that it's already impacting how we make strategic decisions around our business development. And so adding a layer to that strategy is, all right, now how do we take that capital? How do we deploy capital? How do we work with our partners and corporate sponsors and partnerships to ensure that we're deploying capital to really advance our missions of our organizations, but then ultimately work within the healthcare anchor framework, which really is defining our anchor mission.
Thank you so much, Michael, for sharing some compelling reasons as to why UCLA Health is embarking on this. I want to maybe add to what Victor has shared around some of the movements that we made at UCSF. In order to do this work at UCSF, we have to have the complete buy-in and support of our controller, who unfortunately isn't here today, plus her boss, who's the chief financial officer, plus her boss, who is the Senior Vice Chancellor for Finance Admin Services, and ultimately our Chancellor support. So those key levels of leaders' involvement are critical and important. I also want to add, yes, faculty involvement is super critical, but many staff working behind the scenes are very important as well. So we're talking about the finance sector today. And in addition to that, people working in procurement and workforce development, everybody that we've worked with are super excited and thrilled to be part of this effort because they feel by participating in this anchor mission, they feel very closely tied to the mission of our organization, which is to advance health worldwide, not just worldwide, but in our community. I just wanted to quickly note that. And follow up with what Victor, you shared, you as a community partner, speak a bit to how we've engaged you as a community partner and our community investment subcommittee's involvement in piloting the UCSF $5 million pilot.
Yes, thank you. So I'm a community member of the Advisory Council of Wiley's Center for Community Engagement. And as such, when that council took responsibility for the anchor mission, we created 3 subcommittees, and Shannon and I co-chair the one on community investment. This is a good fit with my background at PolicyLink, and where we had a lot of work on engaged institutions and a lot of work on community investment over the years. So the university was able to identify $5 million from the short-term investment pool and made the case up the ladder in the way that Wiley described for the opportunity to put that money on the street, not directly to community-based organizations, but to leading intermediary organizations, community development financial institutions, housing investment funds, small business support organizations with a track record of managing that kind of money. And over a very detailed and fairly lengthy process, administrators and former administrators from UCSF and members of the council created the template, created the context and the framework by which that $5 million could be invested. It resulted in an RFQ, a request for qualifications, which was given to a fair number of community development intermediaries working on employment, on small business development, on social enterprises, and on affordable housing. And eventually, 4 of them found that the terms under which the STIP, the short-term investment pool money, could be offered worked for them, and they proposed how they would fit that into either their existing program or a new program that they were about to start. And we can go into a little of details of what the 4 of them that were selected did. And the beauty of it is, it really is a pilot in the way that Wiley said. The 4 of them are very different from each other. They give us 4 different kinds of experiences of how the values and principles of the anchor mission can be made very tangible. Money that goes to complete affordable housing projects with services for homeless people, money that pays for the employment in socially valuable functions of formerly incarcerated people, money that supports small businesses to be able to become contractors to UCSF, and money that supports entrepreneurs in neighborhood businesses. And I should mention this last one, entrepreneurs of color in neighborhood businesses, that's in Oakland, where Benioff Children's Hospital, Oakland, is now part of UCSF. So 3 are mainly working in San Francisco and 1 in Oakland. We can get into that a little more as time permits, but the pilot has turned out to be a tremendous way of making concrete the values of the anchor mission. The money's been available for almost 2 of the 3 years at this point. And we have a whole evaluation process underway as well.
Thank you for that, Victor. We can delve a bit more into the details later. Maybe the other question I'll ask you is, there's a lot of curiosity around what would be the impact of this investment? And obviously, because this is a financial investment, there is a financial piece, and we are also very, very interested in the social piece. So Victor, we just had our midterm evaluation of our investment work. Please speak to that. Michael, I know you at UCLA Health is beginning to think about this. So initial thoughts that you may have around that would be appreciated.
So the 4 intermediaries, being well established, were able to say, if we had $1 million or $1.5 million, which are the amounts that they each got out of this $5 million, here's where it would fit. And in some cases, they said this will be an absolutely critical bridge loan to an organization we know we already want to support, or to finish a housing development that we know is, missing this bridge, but the project itself is much larger. The REDIF Impact Investment Fund, for example, which supports social enterprises, made its first loan with the UCSF money to Urban Alchemy, which a community-based organization supporting ambassadors and people who work on the streets to improve the quality of life in San Francisco. And those people who are hired are mostly formerly incarcerated. So it's creating jobs and opportunity for them, and it's providing a socially useful service. But by that time, Urban Alchemy had grown like crazy and had a budget of more than $50 million. So the thing is, the key $500,000 or $1 million serves a very particular bridge purpose for them in the moment. Then the money's paid back, it's lent to somebody else. In the case of the Housing Accelerator, it was the bridge in first purpose for a homeless prenatal project, which is unique in the city, if not in the country, in combining those services with affordable housing in one of the most expensive places to build. And the $1 million or so fit a critical gap in the financing. And there's a story for each of the others. The other 2 had rather large numbers of grants of smaller amounts to businesses. But in the case of one other example, Pacific Community Ventures, the one working in Oakland, had a very high standard for good quality jobs in small businesses led by entrepreneurs of color. And putting all that together, this money was one of the two big investments that got that off the ground. But it was an intentional, organized campaign that fit perfectly with the values of the anchor institution mission. But without those CDFIs, without those intermediaries doing all that groundwork, the university alone could not do something like this.
Thank you so much for that. Michael, please.
Yes. So as Wiley mentioned, we are in the beginning stages of this journey. And so defining the criteria for which we invest is an important step in that. And I think the Healthcare Anchor Network's structure, the framework, is a guiding source for that. But then also looking at data that exists both in our just population level data, so social vulnerability, but then also looking at our social drivers data, we could start to really point to what is really needed. In addition to that, having conversations with our community partners and figure out what is happening in community. We know housing is certainly a significant issue, and another emerging issue is food security and food accessibility. And so as we're mapping out our strategies and building criteria for how we think about guiding investment dollars, how we think about creating small business loan programs, small grants, and any type of co-op opportunity that may exist with this financial source, we're thinking about the implications that have ultimately on our patient outcomes. But then in addition to that, as part of our procurement efforts, it's like, how do we invest and ensure that businesses have an opportunity to participate in our value chain? As Victor mentioned, providing opportunities to businesses that have demonstrated effective models that could best serve our same patient populations, or if they have a product or a service that really could bolster what we're doing and as it pertains to our operations is also critical. And there's various examples of how that has already been ignited. I think as we continue to advance inclusivity and creating affirming environments in our organizations, we've already had opportunities to reach out to businesses to ensure that our food services, the products in which we use in our organization can be reflective of the diverse patient populations that we're serving, and that they can have something that affirms their identity in the care process, or is representative of their identity in the way we observe different cultural and religious observances, for example. And so what we've really been focused on is taking our data and making sure that it is informing strategic action, but then also aligning that with qualitative data and anecdotal information that we receive from our partners to say, this is what we need to be doing. And we are a very ambitious bunch where we like to do and try to act as fast as we can. And so we've seen the acceleration and growth of different strategies and initiatives that align with our anchor mission, like our homeless healthcare collaborative, as an example, where there was a need and there was funding opportunity, there was some advocacy, and now we have accelerated the growth of a program in such a short time to extend healthcare to the most vulnerable in our region. And so that is what it really looks like. And as we continue to flesh out what a fund in partnership with a financial institution look like, and what does it mean, and having very clear lines, because we know that there's policies and practices that have to safeguard finance, as Victor mentioned, whether it's intermediary or another partner. We want to ensure that whatever is developed, that it's done in a way that can ensure the viability of the long-term outcomes and benefits.
Thank you, Michael. I really appreciate UCLA's intention to really align your community investment effort with workforce development, with purchasing, with your health equity endeavors, as well as the health justice endeavors. I know we're about at time. Maybe Victor, one quick question around aspirations or UCSF.
You know, and I didn't get to your other part of your question, just to mention that researchers from UCSF, independent of the lending effort, have been interviewing both the intermediaries and the loan recipients. And the initial results they reported last month were very positive, and that all 4 of the intermediaries that received the money submit quarterly reports with a great deal of detail. And several of them have their own concurrent evaluation processes. So we are the beneficiaries of a lot of good information. And at the end of the 3-year pilot, we will be able to build our aspirations on a firm empirical footing. And so that is the, you know, there's, to say it bluntly, there's nothing magical or limiting about $5 million. Perhaps there's more than that available to replicate the pilot if it is proven to be successful. Perhaps there is the capacity in our next phase of this program to put more energy and attention into bringing along potential intermediaries who weren't as shovel ready as the 4 that we selected, to get even more diversity racially and geographically in the leadership and mission of the organizations that could be receiving community investment. I think it's also important to have diversity in the housing investment. We have 1 out of the 4 who work on housing. And if that's going to be critical, we probably need more in housing. We have 3 different employment and enterprise development related ones, but those remain important. The hardest aspiration to fulfill so far has been to directly connect small businesses to being contractors and vendors with UCSF, which we'll be talking about later. And so that would be an aspiration. But if it's successful, I would say that the size of the program could be increased and the range of intermediaries could be broadened, and therefore reach a larger range of ultimate loan recipients and beneficiaries. And that would be a major accomplishment.
Thank you so much, Victor and Michael. I know we're out of time. I just want to make a quick note that in the Q&A, there is a desire for our UC system-wide leaders to join us in making more social impact investment. Just wanted to note that. With that, we conclude this particular session on community investment. Victor and Michael, thank you so much for sharing your informative experiences. We are heading into a break. When you return, you will not want to miss our procurement panel. We are super excited and honored to have our UC Health Chief Procurement Officer, Scott Wilkerson, join us to facilitate that panel. So stay tuned. Thanks, everybody.
Well, good morning, everybody. My name is Scott Wilkerson. I'm the Chief Procurement Officer for UC Health. I'm extremely excited to participate in today's meeting. It's been an incredible learning experience already, and I'm thrilled to introduce several of my colleagues who are the real experts in what we're going to be talking about today. So I'll do a brief introduction, then I'll let them talk further. But let me start with Marlise Capado. So Marlise is a key leader at UCSF in our supply chain and procurement organization. And she's extraordinarily focused in this arena and has great experience. So excited to talk with Marlise today. We also have Annie Reyes Salgado. I work very closely with Annie. So Annie is the Director of Supply Chain and Contracting Services at UC Davis Health. And she's a real thought partner on all that we do. And excited to have Don Parks, also a tremendous thought partner. He's the Director of Procurement and Strategic Sourcing at UCLA Health, and really excited to talk about impact procurement today. And let me just take a moment before we start out with some questions. David Zuckerman made this great comment around community wealth building. And as I think about the opportunities of what we have and how supply chain and procurement can play a significant role in community wealth building. And as we think about, you're going to hear a lot about impact purchasing this morning. And impact purchasing is about how we support our small, our diverse, our community business partners, both in terms of the direct relationship we have with them and those with whom they do business. And so we have the ability to have a significant impact far beyond our direct relationship of who we do business with. So with that, let me start out, and I'm going to ask Annie. So Annie, as you think about your impact procurement journey at UC Davis Health, can you talk a little bit about that?
Sure. Scott, thank you very much. I hope you can hear me okay. I think the theme of the morning is that there's a bug going around, and some of us have caught it. So I hope my voice doesn't go out. Good morning, everybody. It's a pleasure to be here and a true privilege to participate on this panel with my colleagues and to talk on procurement's tremendous potential impact on UC's Anchor Institute mission. I'm Annie Reyes Salgado. I'm the Director of Supply Chain and Contracting Services at UC Davis Health. I've been with the healthcare system for 8 years now. And if you don't mind, I'm going to throw up a visual in terms of just talking through our procurement journey at Davis Health. And just give me a second. So I've been with the health system. Let's see, are you seeing my screen?
Yes.
Okay, perfect. Thank you very much. Our procurement journey began about 3 years ago, and it was really kickstarted by the implementation of the University of California Small Business First program. Modeled after the state's program, essentially this program kind of leveled the playing field for small and disabled veteran-owned businesses. And it really called for awarding contracts to these businesses up to $250,000 without the need for a competitive bid. It was a significant program that could serve an impactful to our community. At that time, you know, all we were implementing a program. Fast track, a few months later, we actually got a call from our partners at Davis Campus Supply Chain, and they said, hey, do you guys want to participate in this diversity expo? It was the very first expo, and guess what? It was March 2020, in the thick of COVID, and we had no idea what we were planning for. But really, our journey has evolved since then. We did the first annual expo. We had great participation. It was virtual. But really, I would say that our journey took a leap when we started to engage with our local diverse chambers of commerce. We had a great partnership with our health equity office, and they connected us to these businesses. And we were hearing stories of these businesses and the pandemic impact. Businesses being shut down, staffing shortages, supply chain shortages. And it really struck a chord accord with me. And that's when we really decided to change how we were going to do things and challenge the team on kind of reassessing our procurement practices. And we asked ourselves, if I'm a small business in the community, is it easy to register as a vendor with a UC? And the reality was it wasn't. So we started to do a lot of work on how do we develop an external website for these businesses? What resources can we put out there? We developed a dedicated email address just for these businesses to register as a vendor. And we also wanted to educate our internal staff, our stakeholders, as well as our buyers on really, did you know that you're already utilizing this small business and can you shift more spend? We continue to engage in outreach efforts along with our Davis campus and our health equity partners. And it was really until then when we really started to see the impact that we can make. So we started to develop metrics and really started to look and dissect the spend that we have with these businesses. And what was really rewarding was when we started to engage our stakeholders and educating them on, you're doing this much spend and these are the business you're already doing with. And these areas where what we call the tail end of that spend, where we can make a true impact in services like plant operations, repairs, IT services that can be done by a small or diverse business. These functions where we know would not impact patient and medical care. And what was really rewarding was to see that our own departments were establishing their own goals around increasing their spend with these businesses. I would be remiss if I didn't mention that there's a lot of work around our teams in food and nutrition services and the work that they are doing to invest in the local community and shifting spend from large distributors and moving it to local and small businesses. But we do still have a lot of work along the way. Our team is dedicated and committed to reviewing all of the things that we can put in place. And more currently, we are deep diving into these zip codes surrounding the medical center and looking at what spend do we have, what opportunities do we have. And as of today, we have about 40 vendors, active vendors in our database in these communities, and we do business with 30 of them. So we have 48 vendors, I'm sorry, and we do business, we had spend with them, 30 of them we have spend with. So there are a lot more opportunities for our team, and I'm proud of the work that we've started.
That's fantastic, Annie. And I know that your deep partnership, as you mentioned, with campus. And so from health and campus working together to really collaborate and drive value there. Dawn, let me switch over. So as you look at UCLA Health, what are some of the strategies that you're doing and looking at that's helping to support this arena as well?
Great, thank you, Scott, and echo Annie's words. It's a privilege to have been invited to this panel, and appreciate all the commitment that everybody in this meeting has towards AIM. I think two areas that have been very common themes, Scott, in today's meeting is a commitment and being very intentional. And as I thought through this over the last week or so, those were two themes that came to light for us as well. The efforts won't occur without the entire organization's commitment and very intentional efforts to help support and build the community health. That obviously is very important in the procurement side as we interact with our suppliers, is that commitment, but being very intentional with it. As we develop true partnerships within our local communities, again focusing in on those communities and the people within, what they want and what they need. This isn't a UCLA or a UC effort going into those communities and telling them what we want. We really need to be listening, to the voices within those communities. What do you need? What are some of the barriers to working with a large organization such as UCLA and UC? Our first year, we really focused, our strategy was developing a backbone, a foundation, resources for not only UCLA, staff members and teams, but the community to really understand what does it take to work within the UC system, providing those resources so that those questions are answered prior to them being asked, and they have some place to go. We've developed a website. Fortunate that we've had some good leaders within San Francisco and Davis to kind of lean on this, lean in, and follow some of their path. As we started about 18 months ago, we really thought, again, very intentional thought, as to what tools do we need to help socialize that commitment to our local communities, right? Not only for the suppliers in those communities, but our staff, within our organization. What do they need? The goal being to really break down, barriers, whether they're perceived or actual, that these suppliers may experience as they attempt to do business within UCLA. And touching on something that Annie, mentioned, even though we were not, officially signed up with the Anchor Institute when COVID broke out, that COVID really taught us that some of our local partners were better positioned to serve us than some of the larger players in the supply chain. Really interesting, to develop those relationships, some of which we've maintained, as we've come out of COVID, but just organically, in times of necessity, understanding that, hey, we have folks right in our own backyard that can really help us. So now as we kind of transition from the creation of that foundation to really beginning to dig in our heels, we've realized this requires engagement from many members, departments. Our business development strategy teams are well positioned with existing relationships in our local communities. Great example of that, are some of our relationships with our sports teams in our local community that, in many cases, these folks that we have sponsorship agreements with are following very similar paths that we are, with their engagement within the local community, local suppliers, and their ability to really impact, those communities that we're, a part of. And then, just one last thing to say, kind of around strategy is really, partnering with our other campuses, our own campus for that matter. In many cases, we kind of charge down roads on our own when others have already gone down these roads. Just simply, collaborating with our, UCLA campus, hey, what suppliers are you using within our local communities, and vice versa, have yielded, many opportunities that we may have not, seen or found, on our own.
Thank you, Don. To build on one point around that, something that we've all been doing, and the Chief Procurement Officer at Cedars-Sinai, we have shared information on who are the diverse suppliers we're all using, and let's share information across other healthcare organizations as well, so that we can help support, right? This is not an area of competitive differentiation. We want to help everyone be successful on that. And so on that, Don, so we do have a lot of pressures, right? We have competitive bid requirements, we have sustainability goals, we have cost pressures. And so we have these competing demands, and I think sometimes there's myths. And I'll start out with one of them. And one of those myths is that it's far more costly to do business with a smaller, diverse supplier. So I'll tee it up with that, but are there any myths that you see in our business partner network that we need to help dismiss?
Yeah, thank you, Scott. Yeah, that one that I think we've heard many times is the ability to work with large suppliers, and the quote unquote myth that they can provide services at a lower cost. I think we've found very clearly that working with local business, working with small and diverse suppliers, many cases they can deliver services to us at a lower cost. I think some of that is due to large businesses have larger overhead. They've got to cover costs of a lot more than maybe some of our local businesses. So I think that truly is a myth that we need to be very, again, intentional on debunking that as a myth. I think I think a lot of our smaller local suppliers just really don't understand what it may take to work with a large organization, and quite frankly, may have the belief that they're not positioned to work with a large organization such as the UC or UCLA. But really helping provide those resources, being out there, connecting with our local community, helping them understand and providing the path that they need, in order to, develop that partnership with us. Educating the supplier, onboarding processes, assisting with, insurance requirements. The UC has done some work, around navigating policies with onboarding and requirements around payment terms. We do have some wiggle room, and the small businesses really need, in many cases, need that assistance. Really just kind of breaking through that red tape that, again, what both perceived and actual of working with a UC. Encouraging those local diverse suppliers and providing the resources that they need, but also socializing this within our organization, both at the UCLA and within the UC as a whole, in that there are resources available. Many people have many contacts with potential suppliers, and being able to have a landing spot for these folks to go to when they're looking at how do I do business with the UC. So Michael, I think, mentioned earlier, really just a very open engagement with the communities is what is critical to achieving our goals.
Yeah, thanks, Don. I mean, yeah, it can be intimidating to do business with us. I mean, just the sheer length of our contracts and those terms, and I think you use the term, intentionality, right? So we have to intentionally work to make it easier to do business with us, which is a great segue. So UCSF has really done tremendous leadership work in this arena. And so Marlies, maybe if you can talk a little bit about the steps that you all have done to engage with potential suppliers and tell us about that.
Absolutely. Thank you, Scott. And hello, all. I want to start by thanking the UC AIM Planning Committee for just putting this wonderful summit together. I am heading into my third year working at UCSF within the campus supply chain management department for goods and services. As the strategic sourcing professional focused on supplier diversity, I'm also the procurement lead for our anchor institution mission work, which has an enterprise-wide focus here at UCSF. And, in terms of engagement, we're a very lean team here at UCSF. So we host 2 diversity virtual outreach events a year, and we parallel that with the nationwide efforts that are happening within supplier diversity. So in May, it's Small Business Month. So we hold one event in May. In August, it's Black Minority-Owned Business Month, and so we hold the second event in August. And so these diversity outreach events are very critical to how we seek and source many of our suppliers. We re-engage our existing supply base to ensure, that they're still currently certified and that nothing has changed. We also seek from outside the community, within our community as well. We invite many of our community partners to join these events. We also started attending supplier diversity expos late last year. That's another way that we attract different vendors. We also get, email correspondence as well. We have a response team that helps filter in inquiries and route them over to our department. I would say that the biggest piece of engagement that we have that works very well for us at UCSF is our collaboration with our community engagement and government relations team. We get invited to many local events with different chambers of commerce within San Francisco and Oakland, as well as merchant associations. And so it's been very helpful to get into the community and have the support of our team here at UCSF to make introductions and get to know the businesses a lot better firsthand.
That's fantastic. I mean, again, I think we can all learn from the things that you are doing, and how can we copy and paste, if you will. So kind of building on that, how are you measuring success in this space?
Yeah, when we first started early on, all we wanted to do was just identify and understand this work. And we realized that until we can move $1 to a diverse vendor and have one diverse vendor on board into our procurement system, we can't really count it as a success, right? Because we have to understand what that process looks like external to us. And so that was our initial goal, was just move $1 and bring in one vendor. And so when we finally achieved that, and we focused on just one particular program, we have a drop-off catering program with the America To Go platform. And so it's a tier 1, tier 2 program. And when we started to onboard vendors, we ended up onboarding 14 vendors, and we moved definitely more than $1 within that program. And we realized that this is possible, but there's still a few areas that we want to address, right? And so we realized that success is really dependent on our partners and our customers, because we're really just more of the guide to steward our community towards the goal. We've recently aligned to the Office of the President goal with the Small Business First program of achieving 25% in certified small and diverse spend. And so that's something that we are working towards as a community. And so that's now our new measure of success, is we're working collaboratively together to attain 25% in diverse spend. And I think this is where we're going to continue to focus on our efforts in measuring.
Fantastic. So across University of California, our capital budget for the next 5 years is about $16.7 billion with a B. There's perhaps never been a greater opportunity for us for outreach, for the opportunity to activate new suppliers in the community, to have a positive impact around that. So as I think of all the conversations today around investment, development, partnership, intentionality. I think there's a lot of those obligations fall to us in the procurement and supply chain arena. So kind of on that note, you know, we have such a wonderful set of people both in this meeting, and I think that will be touched by it in different ways. So let me start with you, Annie. How can others support your efforts specifically and all of our efforts overall? Are there things that others can do to help make this more effective?
Scott, yeah, I'd like to go back to this sort of answers, going back to what Marlise was saying. I think in terms of measures of success, when we talk about procurement, our offices don't necessarily have the final say on who we get to award to, or who we get to contract to, or who we get to procure with. And the measure of success in terms of influence that we have with our stakeholders, and you know, encouraging them to give these small and diverse businesses an opportunity, right? And tagging on to the other myth of we're not going to receive the same level of quality or service. And actually, in a lot of cases, we are going to get better service because we're going to get concierge service, we're going to get dedicated staff. So in terms of how do others support us, I think as we engage with stakeholders, understanding what the purpose is, we call it impact purchasing here. I call it purpose-driven procurement. We have to be intentional, and where can we move that needle? Where can we move that spend? We know we have the leadership backing. It is part of our clinical strategic plan at Davis Health, and we fully have our leadership support. So I think in terms of how others can support us is just understanding what this is all about. And this summit is really a fantastic way of learning more about all of this.
Thank you, Annie. I appreciate that. So, hey, Dawn, same question to you. So what are things that that you need help with from this group or others that we touch?
Yeah, I think, thank you, Scott. I think, you know, continued engagement, continued socializing, you know, what this looks like, you know, continued support, you know, from from UCOP, you know, around, you know, terms and conditions, and, you know, establishing, you know, pathways for our, you know, local small diverse suppliers to be able to, you know, work with us within the UC. You know, I think we really at UCLA have really taken the first year or, you know, 18 months figuring out, you know, are we capturing all of the spend? Are we categorizing suppliers? Do we have suppliers in our, you know, existing database that we're doing business with, you know, that maybe we're not capturing that, and they are, you know, they do fit the criteria, you know, maybe we're already doing business with these folks. So, you know, we really spent the last year and a half with many partners figuring out, you know, are we categorizing them? How do we categorize correctly? You know, so as we've gone down this journey, we've seen increases in, you know, our annual spend. The challenge is, you know, really differentiating what is that, you know, just simply because we're categorizing and we're capturing that appropriately versus what is actual growth. We have, you know, 4 or 5 suppliers, some photographers, some videographers that we have utilized, you know, again, being very intentional by the departments to bring them in that, you know, are within our local communities that we've been able to utilize, load to our database, and are now available for people to use. But yeah, I think it just really continuing to socialize, you know, the Anchor Institute efforts within the organizations and within the UC, that this is something that we're all in together. This isn't a procurement function. This isn't a, you know, the EDI department's, you know, responsibility. This is all of us, you know, and assuring that we're all walking down the same road and down that same path.
Great, thanks, Don. Marlise, same question for you.
Yeah, thank you. So, I echo what Annie and Don said. It's super important to be intentional about what we're doing with our work here in procurement. I mean, we're really leveraging the dollars, right, to create impact. I think, reminding team members about our mission and the responsibility that we have as an institution to steward our resources in good faith is very important. Also giving staff permission, right, to try a small and diverse business without any implication of failing or that it will reflect poorly on them, if they made the wrong choice. I think what we've learned in our work here at UCSF is that there can be an overestimation of a negative risk of failure, which affects the culture dynamic, right? And so often we need just more support from people in leadership positions, just to remind our staff that it is okay to try something new and not fear failing.
Thanks, Marlise. And to build on that point and what Don was saying around the fact that in most cases, we in procurement and supply chain don't decide. We engage in contract, right? That ultimate decision of who to do business with. So that's a combination of partnership on us presenting suppliers in a way that makes them shine and have the greatest opportunity to win. And how do we help our business partner make those choices as well, and understanding that impact. Annie?
Scott, I'd like to add, we have a lot of folks here from the Office of the President, and we've been challenged with policies and potential bills that really have an effect on contracting out for covered service functions that impact these small businesses. We have been challenged with this for the last 3 years, and I think if there's any additional support there, that's where we would need it.
So let me add a thank you, Annie. I almost hesitated to bring up that topic, but I think it's probably important for all to know. What we call is our covered services obligation, which the University of California is committed to not outsource work, which is the right choice to make for our employees in the community. That has had an unusual side effect, is that sometimes that in the process of bringing those services in-house, we have been unable to continue to do business with small and diverse suppliers in the community. And so in the interest, this is one of those, unusual side effects of what was a good policy that's created some challenges for us, and we continue to navigate that. And so I agree with you, Annie. I think for all Office of the President leadership, I think we're doing an okay job of quantifying the impact of what that means on our supplier community, but we need to continue to really highlight that point, that it's a true challenge. So there was a question that came in around what are our percentages and how much have we increased in supplier diversity? So I'll talk overall from a system-wide total, and then if others want to chime in with specifics. So we do have obligations in the state of California for HCI, HCAI annual reporting on our performance. That is a brand new, I think we're only the second or third year on that reporting as a state commitment. And that whole process, even from the state, has evolved and improved over the course of that. System-wide across University of California Health, we actually went up 64%. So we are at almost 131 million in spend that meets the criteria for the HCI reporting. On that note, the significant growth in San Francisco, specifically around the use in the construction arena, that's a huge opportunity for us. And as Don said, tracking these numbers is a little harder than it might appear. And so one is we will continue to get better on that as a system. The second is tier 2. So tier 2 would be those suppliers with whom we do business when they are using diverse suppliers. And so we will be expanding our reporting to support those numbers as well. So you're going to see we're actually doing more than we even report. We're going to continue to show that improvement. So there is kind of organic improvement in our number as well as intentional improvement on that as well. So there's much to be excited about on our increase in numbers, and we have more to go on that point.
And I can add, Scott, that for Davis, non-construction spend from fiscal year 22 to fiscal year 23, our total spend with small and diverse businesses jumped 27% in total spend.
And I think Marlise made the comment earlier, $1, every dollar counts. And so, you know, in an organization like ours where the numbers are so enormous, I almost think we always have to look at this as every dollar is an impact dollar that we make. With that, I think that we're a little bit ahead of schedule. So I would say if there's any specific questions, otherwise I can hand it over to our next topic. Great. Well, I'm excited. So let me say thank you all for the opportunity. I think our contact information is available to all. We and others can mobilize to help support any questions that you have, and we thank you very much for your support on what we can do on impact procurement and our commitment on that. So our next panel is the Workforce Development Panel. Koban Kochai is the Director of the Anchor Institution Mission and Culture Climate Initiatives for UC Davis Health. And I'm happy to hand it over.
Thank you, Scott. That was an excellent discussion. And I'm sure as people are sort of processing everything that they've heard, that more questions will come up. So Scott said we welcome those later. And we hope to continue these types of information sharing as well. So hopefully more to come and more specifics on a lot of what we're doing as well. I work in the Office for Health Equity, Diversity, and Inclusion at UC Davis Health. I'm excited to facilitate this panel, which really takes an HR lens to our community investment efforts. We've heard a lot today about how anchor institutions like health systems and universities are uniquely positioned as economic engines in our communities. And we're often leading employers in our respective areas as well. We heard this morning that the UC system is in fact the state's third largest employer with over 167,000 staff. Establishing an intentional, local, and inclusive workforce development strategy is one of the most impactful ways to improve economic resilience and wealth within our under-resourced communities and ultimately advance health and health equity in our regions. Local hiring prevents displacement of local community members. It promotes workforce diversity and fosters greater community engagement and positive relationships with our surrounding neighbors. It also has positive environmental impact and benefits when considering the distance of travel to work and kind of thinking more locally about how we're hiring. And those are just some of the benefits of really thinking about more intentional local workforce development. Today we have an excellent group of panelists that will tell us about local and inclusive workforce development strategies that they're employing within their respective UC systems. We have Megan Egenbrod, who's a senior organizational development consultant at UCLA Health. We also have Joanna Ramona, manager and talent acquisition at UCLA Health. Drea Yen, who is a diversity and outreach analyst, is joining us from UC Davis. Michael Jones is a workforce development organizational consultant in learning and organizational development and Anchor Institution Mission Workforce Development co-lead at UCSF. And finally, we have Doug Levine, who's the Director of Talent Acquisition and Compensation and Benefits at UC San Diego. So we're going to start off by jumping into some outside-in strategies, which really focus on how We're strengthening our local hiring pipelines. And just a quick note for those that have submitted questions in advance, we've tried our best to incorporate those questions into this discussion, but of course, feel free to continue to ask questions. So I will start off with the first question targeted at Drea. What are some recruitment and outreach tactics you have utilized to increase applications from local communities?
Yeah, absolutely. That's a great question. Thank you, Koban. Hi, everyone. My name is Drea. I am the Diversity and Outreach Analyst here at UC Davis and UC Davis Health. So essentially, my role is to help build strong community partnerships and kind of partner with our recruitment team to build a diverse and equitable pipeline. So to your point and to your question, Koban, it's something that I'm really genuinely passionate about, and I'm really excited to kind of share our current approach. So firstly, we're deeply committed to serving and hiring our local communities. We've heard that across the board today. And for UC Davis, that means Sacramento and Yolo counties. And our core belief is like, if you're from the community, you bring a unique perspective that's vital for our growth. So let's kind of talk a little bit about our tactics, and I'll go through these quickly, but make sure to kind of touch on some very important parts. So one, we have our You Belong Here Job Talk series, which is a virtual job talk series, and it's our flagship initiative. Here, our objective really isn't just to recruit, it's about empowering applicants with knowledge. So in these sessions, we demystify our recruitment process and address potential barriers head on, ensuring that every potential candidate understands how UC Davis operates. And it's really about transparency and ensuring everyone gets a fair chance. Secondly, we have in-person engagements. We're actually gearing up for our first in-person session at Aggie Square launch next month. So hosting a session within the community in collaboration with Aggie Square's Hub of Innovation really ensures that we're presenting accessible information. So we really want it to be more than a job talk. It's an invitation to be part of the family, right in the heart of the community. Thirdly, we have career chats. These are personalized one-on-one discussions with someone from talent acquisition. It's really about understanding an individual's potential and mapping them to roles that could be a perfect fit. So folks can submit a career chat request, chat with me or someone else on our team, and kind of talk about their experience applying to roles at UC Davis. And, we're here to kind of provide support on that end. A couple more pieces. Community employment partnerships are huge. So collaborating with community employment partners really helps kind of us create content, discuss job opportunities, and make sure that we're in line with the community's needs. So by taking part in community job talks, we're like embedding ourselves into the fabric of the community, right? So in return, we're creating and helping create a workforce that mirrors our diversity in our students and the patients that we serve. And then we also have some online resources. So we have a job talk library that's evolving from past events to topics like resume writing and interview skills. We really created a hub for everyone who needs to seek guidance. So we're really about kind of creating that meaningful, long-lasting partnership with our community and kind of blending digital strategies and genuine in-person interactions. We really think that it's going to resonate with our local community.
Thank you, Drea. I love the attention to all those touch points and really being in touch with community and their evolving needs. Doug, I'm going to give that same question to you. Recruitment and outreach tactics that you've utilized at UC San Diego.
Thank you, Koban. If I can modify the question a little bit, because it's not only trying to increase the volume of applicants, but sometimes there's a big population of applicants we already have, but they're not qualifying for the positions, or they're not being seen because of their own qualifications. I'll just give you a case in point. Probably about 5 years ago, I did a little study with our nursing education department, because we're all healthcare institutions, we're all hiring clinical nurse ones or new grad nurses. And most of, if not all of us, are magnet hospitals. And magnet hospitals mean that from a new grad nurse perspective, or any registered nurse, you want the BSNs. We have to have this ratio of 80% having to be BSNs. And so, well, when I looked at all of our new grad nurses and thinking about diversity, the question was, well, what's our pipeline? Where are we hiring new grad registered nurses from? Well, primarily they're from schools that are doing externships with us that are BSN programs. So with the help of the nursing education department, we did outreach to our nursing programs and said, hey, BSN schools, can you tell me what your diversity looks like? And it wasn't that great. And so then we went to our associate degree schools, our ADN schools that typically aren't qualifying for new grad RN jobs because we need the BSNs. That's where the diversity is, right? So now we have this dilemma that we talk a good game about diversity. We want diversity, but then we're saying, if you don't have your BSN, you can't be considered here. So there was a lot of work, a little bit of HR, a little bit of me, a lot of nursing. And so we did a couple of things. Number one, when we apply for positions, there's a questionnaire. One of the questions is, do you have your BSN? Are you an ADN? And there's automatically like a higher scoring for those who have BSN. So the ADNs are kind of getting pushed down below. So then we said, can we reconsider our scoring? If they're enrolled in a BSN program, if they promise to be in a BSN program, will we consider them? So now we said, okay, equal playing field. If you're ADN enrolled or planning on it, you're now scoring the same as a BSN. You're no longer going to get pushed down, because when you're considering hundreds and hundreds of applications, you can't consider every single person. But the next thing, credit to our nursing department, we created something called the DREAM externship program. DREAM is an acronym: Diversity, Retention, Equality, Aspire, Mentor. And this was targeted to the associate degree, more diverse schools. So we target them not as an employee, but just from an externship perspective, and they apply. And so for the last couple of years now, we have these DREAM externs who are usually much more underrepresented, who are associate degree nurses. There's a lot of mentorship from a nursing perspective, but then HR comes in. I come in, let's talk about resume writing. Let's talk about interview tips. Let's talk about your career progression. And so now the great majority of these associate degree nurses, probably, I don't have the final numbers, but easily 95% of these associate degree DREAM externs are now getting jobs with us as a new grad registered nurse, which is helping them, helping their communities, but also helping our diversity numbers for nurses.
That's fantastic. And when you think about the incredible need across the state of California for those nursing positions within healthcare system, and then also the need to have a better representative workforce, given the demographics of California, these types of programs are I think critical. Mike Jones, I'm gonna move over to you, because I know that you at UCSF have also really thought about pipeline programs. And if you could give us some examples of those types of outside-in programs that you've implemented at UCSF.
Absolutely. And first of all, thank you all so much for putting together a wonderful event. The UC AIM Planning Committee, you all did a wonderful job. I think it's really important for us to think about workforce from the lens of a full ecosystem. And when we think about the pathway programs that we develop, they're not developed in a vacuum. So we work very closely with our colleagues at the Center for Science Education and Outreach, and they do a phenomenal job in getting ready individuals from the K through 16 level to have them exposed to careers within healthcare, to have them exposed and to get them mentorship opportunities, partnering very closely with the school districts that are around the Bay Area, so that we're not necessarily waiting for talent to come to us at some point in the future, then we train them. But we're working really diligently with those school districts, led by Don Woodson, of course. And we then are able to understand what is the potential demand for some of the programs that we want to develop. Excuse me. So one of the examples of this is our Highway to ED program, where we work directly with the Oakland Unified School District to design a program that has now bared fruit to be able to have recent high school grads be trained and receive EKG training, and then be able to take on potentially PCT jobs, patient care technician jobs within the ED department. And I think this is a very clear example of being intentional, making sure that we're creating strategies that impact the community. That is one example. Another example, which I'm extremely happy to share, is a program for those who want to become security guards at the organization. So we partnered with a local community-based organization by the name of Young Community Developers. They often work with individuals who are formerly criminal justice involved. And what we've designed is a program that is a fast-track training program with the UCSF Police Department to ensure that we could train, at this point, 10 individuals from the community to be able to obtain opportunities at the organization. I'm really happy to announce that next Thursday is going to be their graduation. I met them this past Monday, and they're all excited about what the prospect of being a potential UCSF team member means. But in sharing those examples, it's always important to remember how we connect it back to not only the organizational impact that these type of training programs could have, but really, what does it mean for the community? How do we ensure that we're creating wealth and we're creating opportunities for people to see themselves grow within the UC system and within UCSF? Inside up, for our incumbent team workers, teammates, for example, we launched a medical training program last year that saw 30 of our own team members that spanned across different departments such as food services, guest relations, some were in IT, some were in the security officer work field. And we took 30 of these individuals in. We trained them over the course of 10 months, and we fully paid for the program at UCSF, where they were able to obtain a medical assistant certification, EKG certification, and phlebotomy. And this has been life-changing for the majority of the individuals who've since been able to secure employment, in that they were able to move from whatever position they had and move into a clinical role where they now see themselves going on to getting a nursing degree or going on to getting a master's in a clinical field of some sort. And this is just a couple of the examples, but once again, not only do we identify what is required for us to be continually successful internally, meaning what's our staffing levels, how do we impact change in the department, but we also think about what will it really mean for that team member, for our community members to be successful. And as the numbers were thrown out earlier, that we're the third largest employer in the state of California, I think it's really essential to understand that we are that community. We are that first community, and then we take that strategy out into the broader community to expand that. And so I think it's always critical to not only have the right partners at the table, but really listen to what people want and understand that you have a large community already inside of your organization to navigate with.
Thank you. Thank you, Michael. Yeah, that comprehensive look at workforce and really thinking, of how to bring all of those elements together, right? How we're getting folks into positions, but then also how are we advancing careers and continuing that economic mobility is critical to that comprehensive strategy. I want to come back to UCLA Health and actually apologize to Shayla Young. Joanna, I neglected that Joanna had to drop out of the panel last minute, but Shayla has joined us. She's a supervisor in talent acquisition at UCLA Health. I want to pose the same question to you, Shayla. Tell us about some of the outreach recruitment strategies that you're employing at UCLA Health.
Yes, of course. Good morning, and thank you so much. So just to kind of get into it quickly, I'd like to highlight some of the UCLA Health talent acquisition. One of the things I want to bring up is that we have been doing this work and most importantly, prioritizing EDI in all that we do prior to becoming a member of HAN and the AIM network. But this now really kind of gives us a chance and a platform to show what we have been doing. We've been walking the walk, and we take pride in being able to share this work that we've always done and spread that philosophy throughout our own organization, as well as sharing that with everyone who's here today. So to talk a little bit about our events and some of the numbers, I want to note that we believe that accessibility to our recruiters is key. So for some context, we have 4 hospitals and over 260 community clinics. So it's important to be where those communities are and that we also reflect those communities. On average, we have close to 100 events that range from talent acquisition hosted events, whether it's our job fairs or maybe our community engagement panels. We also attend local job fairs and conferences, as well as community events across parts of our geographic reach. And we also continue to host our virtual recruiter meet and greet sessions 2 times a week. We try to be as intentional as possible and consistent about working with internal and external partners through programs such as Project Search, which serves our neurodiverse adults. We have a program called Turner Allied Health that serves our high school students in underrepresented communities and local communities and groups. We're also building a partnership with Goodwill Industries. They do a lot of work as a workforce organization. So we are, again, building this partnership so they were able to present general services opportunities and more. And then also for our veterans and their families, we have our Wounded Warrior Project.
Thank you, Shayla, for sharing some of those specifics with us. I will stay with UCLA Health and ask Megan if you can tell us a little bit about the advancement strategies that you employ at your organization. Mike laid out earlier the importance of sort of that comprehensive look at our workforce and really thinking about advancement and career mobility for those that are already within our system. Tell us about some of that work at UCLA Health.
Absolutely. Thank you, Kavan, for the opportunity. And good morning, everyone. My name is Megan Eigenbrode, and I'm really honored to be here to be representing a much larger project group that have been working hard for the past year to create our first ever cohort leadership development program that's actually slated to launch in January 2024. So we're really just getting started. So this 6-month program was created for UCLA Health and David Geffen School of Medicine staff who are eager to grow within the organization and drive our mission from higher levels of leadership. So our learning department really offers a robust suite of courses, especially for those who are pretty seasoned and already have experience in leadership roles. So we really recognized the need to develop programs that encourage internal mobility, especially for staff who face systemic barriers to economic advancement. And as many of you may recall or may even be experiencing right now, it's quite difficult to be competitive as a candidate for your first supervisory or management role, especially if you've not had access to strong mentorship or formal leadership training. So this program acknowledges that challenge and aims to bridge that gap by designing a leadership program specifically for staff who have never held a supervisory position. So I know we have other speakers who are eager to share some of their initiatives, so I won't be able to describe it in great detail about the other program components, but I certainly would be happy. Please reach out. I'd be happy to share a lot more about this process and the program we've created. But I can share a little bit about how we use the kind of HON mission to guide the design of our curriculum and selection process. So the participants will lead the program having advanced skills and competencies that are valued and sought after by our executive leaders and are guided by our leadership competency roadmap that has already kind of been published within the health system. So, and that includes competencies like conflict and performance management. But what really sets this program apart from our other learning opportunities are the monthly learning labs that accompany each workshop. So the learning labs will allow participants to practice their newly acquired skills with their peers, but we know that leadership competence isn't enough to propel careers. Staff need visibility, and they need champions who will advocate for their advancement. So with this understanding, the Learning Lab will also host panels with a cross-section of executive leaders who will provide mentorship through case study work and personal storytelling and other networking opportunities. And kind of switching over to our selection process and how that was designed, we really had accessibility in mind. We want these are individual contributors who might be hourly, they're frontline staff. And so we are going to be holding this program virtually, and we really did our best to reduce the minimum requirements as much as possible. We will have multiple tracks of different leadership tracks for this leadership development program, kind of following a similar structure. But for this first inaugural cohort, again, that focus is really on non-supervisory roles. So our approach to the selection and application process was a little bit different. And we really know that programs that use like essay applications or interviews for selection, they're especially susceptible to bias towards applicants that have higher levels of education. So we've decided to pilot a lottery selection process for all applicants that have meet the minimum criteria, just a couple, which is, being a full-time employee, having at least 1 year of service, and again, no prior supervisory experience, whether that's at UCLA Health or prior. So I really love to share more. This is quite a robust program with many different components, but I really want to be mindful of my time. So I just really want to thank leaders and organizers of this event, but also give a special shout out to my colleagues, Dr. Briggs-Malonson and Michael Whittier, who've really provided a lot of special counsel to ensure that we're effectively driving the Anchor mission in our learning and development space. So thank you.
It's fantastic. Thank you so much, Megan. I think you make some excellent points about leadership, thinking, more intentionally about leadership roles and how we're setting up employees from all of our different demographic backgrounds, in particular, to enter into those roles. We have a lot of those same considerations at UC Davis Health as we sort of see diversity kind of drop off the higher up that you get in leadership positions, thinking more strategically and intentionally about how we're preparing our all of our workforce towards that leadership positioning is really critical. Doug, I'm gonna pass it over to you to tell us about the Emerge program at UC San Diego.
Yeah, thank you, Koban. So the Emerge program is one of our targeted programs. As I think about this question of intentional advancement, we have our general programs and then maybe things that are a little bit more targeted. Like from a general perspective, we've made sure that our job board had a special section for our internal employees, which highlights the My UC Career, which is an online portal, but it's a very good one. And we have a lot of people that use that My UC Career portal to try to advance their career and get some good tips. But we also have partnered with our campus, and we have something called Career Connection. Career Connection is an opportunity for all of our employees to get classes on resume writing and interview tips and how to apply for jobs and what have you. But then to your point about the Emerge program, we did see this gap or this opportunity for our individual contributors. Some are represented, some aren't. It didn't really matter, especially in our health sciences part of the health system that we have, where they weren't getting those promotional opportunities. They weren't having those mentor opportunities. So we developed this Emerge program. Now, by the way, if anybody Googles UCSD Emerge, there's another Emerge program that has to do with gender equality. That's not what this is. This is a different program. But what this is really about is individuals applying who are underrepresented in particular, who really want that career advancement. It's a series of about 8 weeks. Every 2 weeks, there's like a 3 or 4 hour class where we talk about how they can network and build their brand, so to speak, to assist them. I think one more point too, if I can say, and this kind of ties into pipelining, but it also has to do with our internal staff, especially from like our healthcare and nursing group. And locally, we have the San Diego Black Nurses Association. We have the Philippine Nurses Association. We have the National Association of Hispanic Nurses in San Diego. And a lot of our employees are participating in those programs. So we've tried our best to support those programs, not just for external applicants, but for internal too. And what we've often heard is, hey, you're helping me get the job, but you're not helping me get the leadership job. That's where we have those opportunities. And so then we would have special programs or symposiums just for that purpose for these populations.
Thank you, Doug. That's fantastic work going on there. Since we have just a little bit more time than originally anticipated, I'm actually going to come back to Mike on the pathway programs for just a minute. I know that you have a great program there called Excel, and that sort of, I think started out with an outside-in strategy, thinking about how you're pipelining local residents into positions, and now there's a career advancement piece to that as well. Can you talk a little bit about the Excel program, Mike?
Absolutely. And so the Excel program is an acronym for Excellence Through Community Engagement Learning. And what this is a partnership not only with the community, but it's a partnership also with the city and county of San Francisco, So Jewish Vocational Services is our community partner, as well as a number of other organizations that help us to source candidates for this position, for this training. And what it is a 10-week long training program. And it's really key to understand that these things didn't happen overnight. I have to give credit to my colleague, Kelly Anglin, who has been spearheading the work in this area for the last couple of years. And Excel was started about maybe 13 or 14 years ago with our partner at Jewish Vocational Services. And it was an initial program to train individuals to get jobs at the organization. And it has since become one of the main pools for our practice coordinator roles, actually. I think that is really important to understand, is that we now have people who've been here long enough that their own siblings have actually now enrolled in the Excel program as well, because of the quality of training that they received over the 10 weeks of classroom training, then 4 months of internships where they get to work at UCSF and be paid. And our partners at HSA, they help to support a lot of that work as well. And so it's a really critical program because it helps us to get individuals who oftentimes are significantly below the poverty line into training programs that they're already qualified for the most part, meaning they have life experience, they have work experience. And that is a myth that we have to sometimes help people dismantle, is that if you're going through programs that are pipeline programs to get into the organization, somehow you may be less qualified. And I think that is far from the truth. What it is helping people get acclimated to the healthcare space. Folks typically have related, relevant skill sets. We just need to help them get acclimated to the healthcare space. And so the Excel program is one of those programs that we've then parlayed into supporting our folks who graduated into being able to obtain career advancement. And so we created a career advancement program with our partners at Jewish Vocational Services. And once again, Kelly Anglin leads that portion of the work. And we had our first cohort graduate earlier this spring. And these were individuals who were with the organization for a number of years, may have not always seen what the next step could have been, and went through this program, which is basically a fast track portion of a project management training to help them understand what it means to be much more productive in their role if they wanted to, or to potentially seek additional roles. So in addition to the Excel program, I have to go back to our colleagues at CSEO, the Center for Science Education and Outreach, because they've been a true partner in this process. And I remember having a conversation with Don Woodson and Angel Max Guerrero, and I said, what else can we do? And one of the things that they will always tell you is that the relationships that they have with the unified school districts go back decades, right? Once again, these are not things that we quickly put together and that we hope that the relationship and the trust is there forever. These are things that took time, and Don Woodson and his team built this over many, many years. And so I said, hey, Don, we have this Excel program. We train people into becoming practice coordinators. And each year, Don and his team is able to place, we're actually the largest, one of the largest employer partners for the San Francisco Unified School District in terms of summer job placements. I think they place more students with us every summer than they do with most other people. And that is a testament to, once again, the trust. So I said, Don, hey, we have this Excel program. What can we do to expand it? And so now Don and I and many others on the team, including our Imogen team here at UCSF, are thinking about what is that pathway like for a student who's in dual enrollment in college, in high school, pardon me. And once they graduate, how do we get them quickly trained and upskilled to become practice coordinators? What is the next step from there, right? How do we then train them to become medical assistants? And we all know that the Imogen function in all of our organization plays a vital role in keeping us functioning and supporting our patients and our families the way we want to support them. And so we said, okay, well, the end goal for right now could be Imogen. And our Imogen team, they're brilliant. They thought about a way to train individuals internally in partnership with the local workforce teams here in the city of San Francisco. And so now we're building out a full strategy that's looking at what can 4 years do for a student who's graduated high school, right? And this is a type of pathway programs that I believe and I know are impactful and will have generational impacts, because not only are we giving students the opportunity to continue their education, but we're giving them a source of revenue so that being able to put food on the table, being able to stay clothed and homed should not be, hopefully, the primary requirements needed before they could focus on doing good at their job, doing well at school. And so the Center for Science and Education outreach team, I think they've done a phenomenal job in being able to help us bridge that gap. And so I implore everyone on this call, as you think about pathway programs, really think about how do you start early before folks just show up in your programs. And it's not only working with the community, because they are a significant portion of this as well, but we are addressing a problem directly when we see it. How do we prevent that problem from becoming an issue in the first place?
Thank you, Michael, for that. And I think that what I've seen is across our UC systems, there's so many innovative and interesting programs going on. And just want to pitch that one part of, one huge benefit to sort of having this shared anchor institution, mission, group, or collaborative is for us to be able to share and learn from each other. So thank you for that. Megan, I'm going to give it back over to you for just a minute to tell us about your program or your partnership with talent acquisition.
Yes, absolutely. Thank you so much, Kavan, for just another a minute here to recognize that this program also has a really kind of unique component with our partnership with talent acquisition specialists. So we will, thinking again about how it's difficult to be competitive for that internal movement and some of the elements that the program is covering, but often that's just how to really stand out in an interview. A lot of that doesn't, advancement doesn't always mean that you are just able to kind of be reclassified into a role. You are competing with external applicants. So participants will also be having special sessions and one-on-one and kind of group coaching to improve their interview and resume writing skills so that they can really stand out and be prepared when those opportunities come up. So I just wanted to really kind of share that with this group because I think it's really relevant in that the learning and development doesn't always get to partner with talent acquisition. And we're doing a lot of work with the community to help them be competitive for jobs and get into the organization. But there's not always as much effort to put into helping kind of advance and help our internal candidates stand out. So that's just another way that we're really trying to support that internal movement.
That's fantastic. I think taking that holistic view to supporting candidates and as they're both entering our workforce and as they grow within our system, of really thinking about not just skill building, but those soft skills towards, making them stronger competitively for positions. And then once they're here, making them, giving them the resources that they need to continue to thrive is critical. And that's, we've been thinking a lot about that work as well as we're building out our pathway programs here at UC Davis Health. I want to shift us just a little bit to thinking about sort of overall best practices and really, sort of understanding your workforce programs. What are some data considerations to measuring success as you're building out and growing your programs? If you can talk, if you can include some specific metrics that you think about that you collect, that would be great. And I'm going to start this one with Doug.
Yeah, thank you. Metrics is a challenge, and I've noted that there needs to be a synergy between your equal opportunity office, that is those who are running your affirmative action program, with talent acquisition, with your EDI teams. And sometimes you have different metrics, and are they aligned? One particular metric that can be a challenge to discern, but I think is very important, has to do with disparate impact for applicants. And what this really looks like, for those who don't know, it's, you have this applicant pool that comes in, and we'll call this here's your applicant pool, and then a certain percentage go to the referral pool to managers, and a certain group of those goes into the interview pool, and so many people go into the offer pool. Well, what's your ratios for underrepresentation and for gender? What percent is Hispanic or Black or Asian within this particular group? And then as it moves from this one to this one to this one, this is what we call disparate impact. And the Office for Federal Contractor Compliance Program, or OFCCP, when they come and do an audit for your affirmative action program, and this is often one of the questions they're asking is, are you running disparate impact? It's not easy to do. You have to have an expert to do it. I've dabbled in it. I wouldn't say I'm an expert. I get it. But having a solid analyst who knows that, for us, I think that's our challenge, getting someone who can do that for us, funding it for that purpose. So it's a supplement to our EDI team or our HR team or our affirmative action team. We did something a few years back on a very large population within our health system. because you assume like none of us are doing anything inappropriate. But what we've found is that in this particular group of individuals, large body of individuals that we hired in healthcare over a 3-year period, that about 17% of the individuals referred got hired. If you were Caucasian, it was 19. If you were Hispanic, Asian, or Black, it was 14 to 15. It's like, okay. If I'm talking about one job requisition, it's case by case. But over a 3-year period, when you consistently see, okay, now we have an issue. So it's running those type of metrics and actually doing a deep dive, which then allows you to say, okay, everybody, let's stop what we're doing. There could be some unconscious bias here that we're not in tune with.
Great, thank you, Doug. Yeah, I will just add that here at UC Davis Health, and we've had our anchor institution mission in that close partnership with HR since 2020. The data piece has been a real journey for us, really understanding the infrastructural needs to understand data across the systems that we're using, because you are sort of trying to understand the applicant experience and the across the life of their time with us. So you want to understand the data when it comes to applicants, the number of applicants, the types of applicants, the types of positions as they're coming into the system, thinking about how they're who's making it to interview, who's actually making it to hire. Once they're in our system, we want to understand, upward mobility. We want to understand, promotion and advancement, and how we're capturing that element of data. And then there's also, I think, that bigger piece that's been really important to us is understanding our market trends, right? The local market trends, and then being able to compare that and understand our own job data. So, what are those high vacancy, high need positions? What really are the ways that we're bringing folks into those positions? And so we really weren't able to do that kind of comprehensive data analysis until we had a data analyst on the team that has that specific training and expertise. And you can't, it's very difficult, I think, like you said, to sort of piece that together without having that core FTE. So can't support that more. I think we've had a very similar experience, and it's only now, I think, where we have that understanding of our metrics at those different points is where we can really kind of build out these strategies and be more intentional in our efforts to around our workforce development. I'm gonna go over to Shayla. Can you? It's the same question to you. What are some data considerations and towards measuring success in your work?
Yeah, so like Doug alluded, we too also at our campus have a partnership with our EEO office. And it's just really great. It helps to understand the local labor markets and how our employee makeup and hiring composition meets the expected labor market availability. So fortunately for us, we do have we do have a senior HR analyst who is really key in our partnership in pulling that relevant data on applicants and employees, so we can see the demographic breakdown by race, age, gender. So we've been very fortunate in that aspect. It is important to understand the demographics of your community. Is there an alignment of your applicant pool demographic to the county population? So in doing this exercise and this analysis regularly, it really helps to address any gaps and then also tailor our recruitment tactics and outreach to those findings.
Thank you, Shayla. I'm gonna close out the panel here so that we have time for questions from the audience. So my final question to the group is, what is one piece of advice that you would give to groups just getting started in this work? And I will start with Mike.
Thank you. I would say admit your deficiencies. Go into this knowing that there could be opportunities for improvement. and work closely with the people you're trying to support. Don't make changes in policies and projects and goals for the folks you're going to support without talking to them.
Thank you, Mike. Drea?
Absolutely. I think just to kind of jump into things and kind of bounce off Mike there, it's definitely about engaging authentically. So just drawing from my experience at UC Davis and UC Davis Health, a cornerstone piece of advice that I'd offer would be to engage authentically with the community. And while numbers are very important, metrics are very important because it helps guide our decision making. I really do think that genuine trust and relationships you build within the community is what creates that lasting change and sustainability. So like dive deep, listen actively, and always prioritize genuine connections over just check boxes, if that makes sense.
That makes a lot of sense. Thank you, Drea. Megan?
Thank you. So I would just say, because I'm early in this work as well. So I think really just trying to have the courage to come in and listen and to really self-educate. I think in the learning and development space in general, there's just not like, it really does kind of require your own self-education and really as both Drea and Mike were describing, like really being open to listen, knowing that there is a lot to learn. And so that's really kind of the approach I took. And again, I'm just one person as part of a larger project group here representing, but that certainly was for me. I know I didn't want to do this program or our staff any disservices, and recognizing that, but my effort is here. Like my desire to help and grow and advance all of our staff is here. And I have colleagues that I can rely on to really kind of help advance my knowledge and education, so that we're really thinking about program development in a different way with a social justice and equity lens.
Thank you, Megan. Shayla?
Yeah, so piece of advice, don't forget that your team should encompass all different parts of EDI work. Essentially, at any moment, be able to speak to all of the efforts and tangible items that can tie to each arm of the acronym. And of course, make sure you're reminding those around you that EDI should and can be kind of woven into every role. We do have active conversations with our hiring managers so that they are aware that they do participate in EDI, even if they don't see it. So we want to make sure that they know that they play a part in it as well. This is a very important thing to our team. We've previously developed our own talent acquisition EDI statement a few years ago, and it's really what drives us. It's a public-facing statement. We do have it on our website. I won't read the whole thing to you. I'll just, give you one liner that really kind of stands out to me that I really appreciate, is that UCLA Health Talent Acquisition cultivates diverse talent pools and empowers our staff to innovate so that healthcare, research, and education at UCLA Health remains equitable to all. So that was one of the things that's always stood out to me about our statement. So again, just making sure that people know that we all play a part in EDI.
Thank you, Shayla. And Doug.
My thoughts are similar to Shayla's. But it would be kind of a two-part to your answer. You have to identify who your champions are, but then you need your dedicated individuals. So like the talent acquisition team have to be champions, to Shayla's point. We've also told our leaders that recruitment and EDI and understanding affirmative action is a core competency to a manager. You have to understand it. Just like you understand finance and budget, you have to understand you're a champion of these things. We've also taught a class called Hire for Diversity to our leaders, where we say, when you go back to your department, you have all these committees. You got the party planning committee and the safety committee. Do you have an EDI committee? So we've said you need to identify champions in your own department to help supplement the managers, because the managers can't do it all. So why don't you have a committee within your own department, just like all these other committees? So you need champions embedded everywhere. But at the same time, you have to have dedicated people for this job, because when you have a lot of people doing it by committee, you get a lot of accomplished, but you don't make the forward progression. You don't have the vision part of it. So really having individuals where this can be, no, this is their dedicated job to move this forward. And then you have all of these champions in the territory, so to speak, or within the house or your healthcare system to help you move this forward.
Thank you, Doug. I think that's excellent advice from our panelists in terms of sort of starting off this work. I'm going to move into some questions from the Q&A section here, and feel free to just for any panel member that can answer these questions directly, you can raise your hand or just unmute and jump in. So we have a question about including people re-entering communities from incarceration into programmings. For any UC who might be afraid to take the risk of employing people with conviction histories, what can panelists share about the value of such employees for our organizations, or the value of these employment opportunities to local communities? Go ahead, Doug.
Yeah, I think the first thing that came to mind when I read that question, I saw it, is what we've kind of shared with our team, and this applies to those with criminal histories and other circumstances that have maybe been negative in the past, is don't freeze people in time. Don't freeze people in time. And at the same time, making sure that you're viewing those with a criminal history as a protected class. And so, just as I wouldn't ask, are you pregnant and where were you born and what is your race during an interview, from an application process, that's a protected class. And so we don't ask that question anymore on our application. Now, it definitely will come up in a criminal check. There's still a contingency. We have a policy to adjudicate to, but it's having a spirit of reasonableness and not freezing people in time so that we can consider the individuals.
Thank you, Doug.
30 seconds. I appreciate what Doug has shared. And I think it starts with your policy, right? Look at what your policy is. Some of our policies may have worked for the specific time we were in. And as we continue to scale as an organization, think about what your policy says. So at UCSF, we've looked at what our adjudication process, of course, looks like. We've also looked at what our background check process looks like in general. We've also made sure that we've made clear language available on our job site. When individuals apply, we've removed the disclosure form. No one needs to tell us at the point of application or submittal. We've also removed potential barriers such as cannabis use from prohibiting folks to be able to get employment. And so we still do the battery of other substance assessment, but marijuana is not necessarily counted against you in that sense. So it's really thinking about where are you as an organization, what is your policy, and how do you ensure that the policy is representative of the a fair hiring process.
Thank you, Michael. Would anyone else like to respond?
Okay. I think they covered it greatly. I just want to chime in here very quickly. I want to be mindful of time, is that, again, it's just really important that we are also doing as much as we can to remove those barriers for employment. And so we have taken a look. We also want to make sure that we are considering the whole candidate as well as the position that they are applying to, and not immediately disqualifying them just because of something that's happened in their past.
Thank you, Shayla. And it looks like UCSF has also posted some resources in the Q&A for those that are interested in looking at some affirmative action resources from that unit. Well, I want to thank the panelists today for your time, for your excellent expertise, in sharing the great work that you're doing across your organizations. I think folks would be eager to learn more, and we'll be reaching out with more questions as well. And I encourage those of you that are here today to ask those questions of each other. and share resources, share knowledge, because that's what's going to allow us as a UC system to really move our work forward, growing each other's work. So thank you all again. I'm going to hand things over for the final part of our summit today to Renee Colvin, who's the program manager for communications and grant writing at Anchor Institution Mission at UCSF. Renee.
There we are. Thank you, Koban, for handing it over. And I'm happy to be with you all this evening. I cannot tell you how excited we are to see the numbers of participants and to really actively engage with you all around the questions that you're asking. We've been planning this event for some time, and sort of seeing it come to fruition is just, it's amazing. As Koban mentioned, I am Renee Colvin, the program manager for communications and grant writing at the UCSF Anchor Institution Mission. And I wanted to come to you all today to say a few words to summarize what we've heard before I turn it over to our esteemed closing speakers to wrap up the event. I have a background in training, and one of the tools of that trade is to tell people what you'll say, to say it, and then to tell them what you've said. So it is in that vein that I want to reiterate some of the salient points we've heard from the panelists today. We've heard that the Anchor mission is the right thing to do. It may be the only transformational strategy we have to impact the social determinants of health and to improve the health and well-being of underserved communities. Anchor aligns with the intentions of the 10 UCs as land-grant institutions and is well aligned with the current work of the UC Office of the President. And we've also heard that there is a strong desire for UC as a system to adopt an Anchor mission. Anchor really represents a culture shift toward health equity, and what we understand is that culture shift takes time. But beyond the scope of a single project or a single program, Anchor really enables us to intentionally commit to move resources into communities and to partner with communities over the long term, beyond the tenure of current faculty, staff, and learners. As I've mentioned, I am incredibly humbled by the work our panelists and the respective UCs are doing to further the Anchor mission across their respective regions and across the state. And I expect that over the coming days, as we all process what we've heard today, and I'm sure each UC and within the collective UC Anchor Institution mission as a whole, we'll be looking forward to further engaging with UC system-wide leadership around the priorities that the panelists and participants have articulated during the presentations today and in the Q&A. Finally, as one of the panelists mentioned earlier, I really want to encourage us all to see the Anchor mission as a kind of a North Star, and to ask ourselves not only about the barriers we face, but from a more strengths-based place to ask ourselves, how can we leverage the assets that we have to move forward toward what we know is best for our campuses and for the UC system as a whole. And without further delay, I will move into the introduction of our closing speaker, Dr. Talmadge King. Dr. King is the Interim Executive Vice President of UC Health, Dean of the School of Medicine, and Vice Chancellor of Medical Affairs at the University of California, San Francisco. Dr. King is a member of the National Academy of Medicine, the American Academy of Arts and Sciences, and the Association of American Physicians. He is also a member of the American Clinical and Climatological Association and the Fleischner Society. He's a master of the American College of Physicians and a fellow of the American College of Chest Physicians. Dr. King is a past president of the American Thoracic Society and past secretary-treasurer of the American Board of Internal Medicine. In terms of accolades, he has received the Trudeau Medal from the American Thoracic Society, the Breathing for Life Award from the Foundation of the American Thoracic Society, and the 2016 Association of Professors of Medicine, Robert H. Williams, MD, Distinguished Chair of Medicine Award. In short, he is a leader with heart. His research interest is in pathogenesis, diagnosis, and management of inflammatory and immunological lung injury. His bibliography comprises more than 300 publications. He has co-authored 14 books, including the reference books Interstitial Lung Disease and Murray and Nadell's Textbook of Respiratory Medicine. Everyone, Dr. Talmadge King.
So thank you so much, Renee, for this introduction. It's been an honor to participate in this session today of the various campuses and academic health centers. And I appreciate the opportunity to close out what has been an engaging and collaborative summit. I want to express my gratitude to UCLA, UCSD, UC Davis, and UCSF for embracing the Anchor Institution mission and contributing to the summit's success. Your collaborative efforts underscore the collective power of the University of California to impact not just what our patients need, but what our communities need as well. And thank you to everyone who joined today, who may be curious about also formally adopting the mission of Anchor Institutions. So as Dean of the UCSF School of Medicine, I believe it is a core part of my role to consider what impact we can have as a leading school of medicine and as one of the largest employers in the region. For me, a watershed moment occurred in 2015 when the School of Medicine's leadership retreat focused on race matters at UCSF. The discussion catalyzed a body of work we subsequently called Differences Matter, which focused on making UCSF one of the most diverse, equitable, and inclusive academic institutions in the nation. In this effort, we aspire to address structural barriers to equity and opportunity, to recruit faculty members who reflect the communities we serve, and to build teams with diverse experiences and backgrounds to solve the most challenging problems in medicine and science. As you've heard from my colleagues, from these discussions also emerged a focus on economic security and social drivers of health within San Francisco and Bay Area communities, and how these structural determinants show up inside and outside our hospital walls. I want to make a special acknowledgement to Dr. Howard Pinderhughes and Wiley Liu for championing this cause, aligning resources to address economic and racial disparities impacting our diverse Bay Area community. By embracing the Anchor Institution mission, UCSF has formalized our campus's commitment and allocated resources to promote economic security and opportunity in underserved communities, thereby advancing health equity. We implement local hiring initiatives, setting objectives for substantial construction projects, like our recently inaugurated research building, Pride Hall, on the San Francisco General Campus, while also emphasizing procurement from small and diverse businesses. As we all reflect on today's discussion, it is evident that we are at the inception of a very promising journey. The UC system, through its education, discovery of treatments, and delivery of exceptional care, is a transformative force in the communities we serve. By adopting the Anchor mission, we are advancing our commitment to health equity by taking on equitable approaches to workforce development, procurement, and community investment. Our gathering today is also not just inspirational, but a testament to the potential of adopting the values of the Anchor mission across all UC campuses, working towards a more holistic approach to our public service mission. As we consider the next steps, two actions stand out for me. One is continuing collaboration, and the other is reinforcing commitment. The UC system, being one of the largest employers in the state, holds significant collective power to advance both wealth and health equity. The recent $5 million workforce grant is a testament to the impacts we can achieve when we work together. As many people have already stated, change is incremental, but our shared mission to improve health outcomes and economic opportunity binds us together. I urge UCOP leaders, academic health center leaders, and faculty to build upon these conversations and consider making systems changes a policy priority moving forward. These challenges are big, and there's never a silver bullet. However, if we continue to think broadly and use our many different approaches, we can truly impact the lives of those around us. Collaboration is at the heart of the Anchor Institute mission, just as it is at the heart of UC Health. I look forward to seeing how our system can continue to holistically serve the communities of California and beyond. So I was deeply impressed by all of those who spoke today. It once again reinforced in me this strong feeling I have that California is a unique place. The University of California is a unique institution. And I know that if we work together, we can accomplish so much more for our citizens of California, for our country, and we can actually advance health worldwide. I thank you all for your participation, and I very much appreciate this effort, and I look forward to the next steps. So Renee, thank you.
Thank you, Dr. King. As my colleague Rachael is sharing the final slide, I want to sort of take us out today by thanking you all for your time and attention. We know that you could have chosen to spend your energy anyplace else, and we are honored that you shared the time with us today. As some of you have probably gathered, we've captured a lot of the questions that you've asked in the Q&A, and we will respond to those questions, as well as send you access to the recording in the days following today's event. Rachael has the slide here with all of the amazing people who helped to plan the events today. And also on that slide at the very bottom is the contact information for the UCSF Anchor Institution mission, where you all can send any immediate questions or comments that you have. Thank you all, and I hope you enjoy the rest of your day.